Good morning, everybody. Good morning. It's been a very long week and the morning has started. Thank you, sorry. I don't even know what buttons to push right now. Thank you. Okay. Good morning, everybody. I want to welcome everybody to February 17th. The first segment subcommittee we are going to start with are regulations and protection. And I want to say good morning to all my members here today. And let's see, I don't know, is Senator Austin on? No, I don't think so. I will go to my ranking. Representative Nucio.
Thank you, Madam Chair. It's Friday, so it's been a long week.
Yes,
Looking forward to today and learning more in this subcommittee. Thank you.
Thank you. And I don't see, I guess it's you and I today.
Just us.
That's good.
House
The house
for the win.
yeah. Okay. Good morning. Good morning. Good morning. First, we have the Commission on Human Rights and Opportunities, and they are on now. So good morning, ma'am. Good morning.
Good morning, Representative Walker, to Senator Olston, Senator Bethel, Representative Nuccio, and members of the committee. I'm Tanya Hughes. I'm the Executive Director at the Commission on Human Rights and Opportunities. I have with me a team of representatives from my agency, Deputy Director Attorney Cheryl Sharp. She's head of recruitment and chief of operations, and she can provide a lot of information for you. We also have attorney Michelle Dumas-Kuhler and attorney Kimberly Jacobson. They are our new legal directors, and we've had quite a few changes to our legal department, new additions, new responsibilities, and divisions of responsibilities. And so they can provide explanations with respect to that. We also have with us attorney Darcy Strand. She's our legislative analyst, and she can provide additional information with respect to the disparity study and the equity study. And I know we're very short on time, so I wanted to initially bring to your attention the current listing in the budget of 84 appropriated positions. We did mention in our testimony that while it's listed as 84 positions, we did receive 4 additional positions associated with the Clean Slate Bill. And so we wanted to make certain that you're well aware that we're requesting approval of those 4 additional positions as well. And they've already been approved through the UKG system on all levels. We've already started recruiting, and we actually are currently planning for interviews. So any assistance you can provide would be very helpful. And I'll end there and accept any questions that you have for us.
Good morning, Tanya. It's great to see you and your team. I do have a few questions, and I'm going to start right quickly with, so you have 84 filled positions right now in CHRO?
We do not have 84 totally filled positions. We have a few durational positions, and I'm going to ask Cheryl to chime in because she has the more finite numbers, and I know you want that detailed information.
Thank you. Good morning, Cheryl.
Morning. So we have 84.
Who are you? I'm sorry, I shouldn't have said good morning, Cheryl. Would you just give your name for the record, please, Cheryl?
Sure. Cheryl Sharp. I'm an attorney and the Deputy Executive Director of the CHRO. And we have 84 appropriated positions, but the number should say 88 because of the 4 clean slate. We have 72 filled positions. We have 3 offers that have already been made with start dates of 2/24 for 2 individuals and a start date of 4, I believe it's 7 for the 3rd individual. We're in the midst of recruitment for 5 additional positions at this current moment. And the other positions that are open, we are either in the posting stage for our regional manager in our capital region and in other stages of the recruitment process where the positions are either pending with DOL, whom we are APO to, or pending at OPM for their 4 layers of approval that they have there.
Thank you. So I just want to recap so I make sure I understand. So theoretically, you have on paper 84, but
Yes.
in your office filled and you are paying for 72, you have 3 that have an offer, and then you also have 4 that are required with the clean slate bill. So is that correct?
That is correct. In addition to that, we also have other positions for other positions that are in the process of recruitment. So they're in stages of recruitment. Like the regional manager position is at the posting stage, whereas the attorney positions for the clean slate bill, there are 2 of them. They're in the stage of interviews. The 2
But
human rights.
Cheryl, we just wanted to know exactly what have you got filled in your positions? That's a difficult a difficult number to get from each agency, because they also have things in limbo because it takes so long for positions to get filled. It's
Right.
hard for us to determine that, but thank you.
Can I add one last thing? We also, in addition to those 84 positions, have 9 durational positions that are currently filled right now.
When you
So
say durational, could you explain that, please?
sure, durational meaning that the positions either end on June 30th, 2023, with a request for a budget expansion to have them be extended until June 30th, 2024, or positions that are slated to end in June 30th of 2024. So currently we have 2 positions that are slated to end where people they're in the positions now on June 30th of 2024. But we have 7 durational positions that are currently filled, that those positions will end on June 30th of 2023. However, we would like to use our any surplus to have those positions extended until June of 2024. And those are COVID-related positions that are dealing with the influx of COVID cases that we received.
Okay, so when you say durational, you're talking, if I'm not mistaken, those are people who have retired and can come back for a maximum of 120 hours? Is that
No, those are temporary worker retirees would be what
Okay.
you're referring to for the 120-day position. The
Okay.
durationals meaning that they have an end date, they have a start date and they have an end date.
Okay,
And it doesn't get extended unless a request is submitted and granted by OPM, because there is funding available to fund the positions, and we have to do a justification similar to the justification that we have to do to fill permanent full-time positions. And then you have to
And they
state.
were delayed in getting started, Representative Walker. That's why we're asking for an extension, because we weren't able to get them hired at the original start date, and we still need them to complete the work that was originally requested.
all right, thank you, thank you. I'm glad we cleared up what durational is. Moving on, I have one other area and I'm going to open it up to my members. Can I get a copy of the disparity report now? Hello?
Darcy, the report?
Yeah,
Darcy, would you please provide the update on the status of the disparity study? Thank you.
Sure. So it's not done yet. It's supposed to take the timeline we were always given was about 18 months to 24 months. So it started last spring and is still on track to be done. The firm that we contracted with, named Griffin & Strong, is on track to be done in March of 2024.
so I will still be in the General Assembly, right? So I can get a copy?
Here's hoping. We are all hoping we will still be employed by the state and still be here when we finally get.
And the equity study?
The equity study is moving along and is due to be done in October of this year. So that is a quicker turnaround. It's supposed to be about a 9-month study.
And I mean, briefly, in 1 minute, can you tell me why did equity study take less time than the disparity study?
Yeah, that one was supposed to take less time simply because under statute, it was supposed to take less time. So the disparity study didn't have a date by which it was supposed to be returned. And generally speaking, countrywide, when disparity studies are done, they typically take 18 to 24 months. And we had assumed from the beginning, because as you know, it had been so long since Connecticut has done a disparity study, we had assumed it'd be on the longer end. And once we began the study, it was clear that it was going to take such a long time to get through the data assessment and data gathering phase, that it was going to be closer to 24 months. That it was pretty clear it was going to take
Who did we,
2 years.
can I ask, who did we
Mhm.
contract with to do?
It's a group called Griffin and Strong that are based out of Atlanta.
I'm sorry, say the name again.
Griffin and Strong, based out of Atlanta. I can get you the information on
Would you
the,
send it to the Madam Administrator so that we could share that with everybody?
absolutely happy to do that.
Thank you.
Sure.
Representative? Question?
Thank you, Madam Chair, and good morning. I have a couple of questions I just want to clear up. So right now, the 84 that is reflected in your positions, where are the four for clean slate reflected, if not in your budget?
Those positions are that's what we're saying. It appears to be, I don't know if it's a Scribner's error or what, but those 4 positions would make our position count be 88, but it says 84. And so we're working with OPM to look at that correction being made as well. We did meet with our budget analyst regarding that because our position is that it should be 88. That's what the legislation indicated, that there were 4 positions associated with the passage of the clean slate bill.
So do you have those people working, or do you not have them? Like, I'm just looking at it. They're somewhere in the budget, so it's a matter of transferring that, but do they already exist?
So where those 4 positions are that we have 2 of the positions for the 2 attorneys, they're being interviewed. And then the 2 human rights trainee positions are going to be closed, I believe, next week. So they've been posted. There's a recruitment out. People are applying for those positions. And as soon as it closes, then we'll go through the list and interview the individuals who are eligible to be interviewed for those 2 positions.
All right, so it sounds like they are somewhere in the budget. It's just a matter of getting them reflected correctly in your area.
Correct.
Yes.
They were all
Yes.
approved through the UKG system, and they went through all the different levels of approval. So I think it was just, as Cheryl said, a Scribner's error.
Okay. The next question that I have is in regard to the durational positions. I'm assuming the expense for those durational positions are built into the budget, because there's a line that's just saying they're reflective of reducing 2 durational positions and not all 9.
So the way that we read that was that they were going to extend those 2 positions, which they were when we did the recruitment. It was indicated that those positions would expire on June 30th of 2024. The other 7 positions are slated to end in June of 2023. And what we were told is that what we would have to do is provide justifications for the extension of those positions until 2024. And what hopefully can happen is that we can use any surplus available to pay for the cost of continuing those positions.
Okay, so I just want to make sure I'm hearing you right then. So the 9 positions that are in the current year and the current budget, there's 0 shown. I guess my confusion is there's 0 in 2024, which would indicate to me that they're not making any changes to the expense projection for 2024. And then they're reducing 2 headcount in 2025, which to me would mean there's 2 headcount in 2024 if they're reducing. So I guess I'm trying to follow the math of where the dollars are currently. And if it's just 2 positions that are in 2024, you're looking for extension of the additional 7 through 24.
Yes. Yes.
Or in 25 or just through 24?
through 24 and 25, when we did the budget expansion, our request was to initially have the positions extended through 2024, and then for those positions to become permanent, because the issue is that there wasn't a retraction in terms of the number of cases that were related to COVID. It's that the type of case that was related to COVID may have changed. So initially, we were getting a lot of complaints related to accommodation and perceived disability. Then there were a host of cases related to discrimination based on perception because the person had, belonged to a protected class status, that they were Asian, and then they were being discriminated against, or that they were students of color going out to being bused out to schools, and then they were being treated differently. So we were getting all types of different cases that were related to the pandemic, and they didn't retreat. We still are having those types of cases filed. So initially we thought that it would only last for a couple of years, that we would be receiving those types of cases, but that hasn't borne out to be true. The cases continue, they persist, and they're related to COVID and to the pandemic.
Can you get, for the subcommittee meetings, can you provide documentation for that, for the cases, the case increases, and also specifically for the cost of the nine durational positions, what that would look like?
Yes, we definitely can. We sent that to OPM, the information regarding the types of cases that were being filed as backup when we got the two extensions of the two positions that are going to go forward into 2024. So we certainly can provide that to you as well.
That would be useful. And if you could include what your case volume looked like prior to COVID, so we can see the clear directional input, that would be useful also.
Yes.
Thank you very much. That's it, Madam Chair.
Thank you. Representative Nolan.
Thank you, Madam Chair. Good morning.
Good morning.
Good morning.
In regards to the disparity and equity study, I was just wondering, do we always use the full 24 months as stated earlier, or is there options of doing it before then or getting it done before then?
So it's been 30 years since we've had a disparity study. And so we anticipated that it would take the full 24 months because of that long lapse in time. We wanted to make certain that it was thorough and accurate and complete. And so we do anticipate it being that full amount of time. However, everything is progressing well. The costs seem to be much lower than anticipated. And I think that's a good thing to note. And so we'll report out as more information comes, and we can provide you more frequent updates if you have interest in that.
Yeah, it would be great to get some updates just so we can have a status in regards to where we are. Many of us are getting questioned in regards to this, and to be able to give them updates in regards to it would be great, because I understand it's been a long time since one's been done, but people are getting anxious.
Absolutely.
To make sure that things that are the way our policy is now, that hopefully this disparity study will show where we need to make the changes in our policy to make sure that it's right.
Yes, I agree. And we've actually updated our website to direct more traffic regarding the disparity study. We're going to have more information portals for the disparity study, and we can set up a separate meeting if you'd like to discuss that. And Darcy, did you want to add anything?
Yeah, I just wanted to add real quick, Representative Nolan, that so as I think I mentioned to Representative Walker, we're sort of in the data gathering, data assessment stage right now, which is obviously very state focused. So there hasn't been a lot of public engagement beyond the public meetings that we had back in October, I believe. But Griffin and Strong is on track to begin moving back into kind of the public phase of the project in late March, early April. So at that point, a lot of your constituents, a lot of the contractors and other people we've all been hearing from who are kind of wondering what's going on with the study should be able to get back involved in in terms of the anecdotal interviews, the phone surveys, the focus groups, the public hearings, that phase of the study is just around the corner. So this kind of data gathering phase took a long time just because, as we've been saying, it's been such a long time since we've done a disparity study, but we're right around the corner from the more public phase of the study.
Okay. Any kind of informative information that you can give us to share with our constituents in regards to even what things you're doing or how it's going, where you're at, so we can put it out on our social networks and or in conversation would be very helpful. Thank you.
Will do.
Absolutely.
Absolutely.
Thank you, Madam Chair.
Thank you. Are there any other questions from me? Yes.
Good morning. Thank you, Madam Chair. Just on the durational positions, you sort of answered part of the question about, what their activities have been. I just was curious, what outstanding projects do we have, that where you're looking for that extension on those 7 positions? If you could share a little bit about that.
To answer the question, the durational positions, the individuals in those positions work on intake, mediation, investigation of complaints of discrimination, prosecution of complaints of discrimination that are related to the pandemic or related to COVID. We have complaints where individuals file based on their disability and say that they're not being accommodated or they didn't receive housing related to COVID. We have cases that are, so it's the case processing and the prosecution or litigation or education and outreach and training related to the pandemic crisis that we've been in for the past few years. And so there are cases that have been fully processed to closure, and then there are cases that are still pending. So those individuals would be working on cases that are still pending and additional cases that are filed, the intakes of those cases, the inquiries that come in, the producing forms that make it easier for the public to be able to file complaints and make it easier for stakeholders to understand our process. Outreach to communities who are trying to let their constituency know what is available in terms of the services that our agency provides. And so it is a broad range of activities that those individuals will be engaged in and continue to be engaged in that could not be absorbed by the other staff that we have at the agency, because those cases are new. A lot of the cases are cases of first impression because this is a new normal that we were thrust into. And so there was a lot of research associated with the cases, and there will continue to be a lot of research associated with those types of cases that have been filed with us. There are also some individuals who have had to work on health equity because of the morbidity rates were higher for certain communities than for other communities. We had to bring in a specialist to help us through all of that, the health equity issues. And so those, we had staff people, those durational employees working on those issues as well. And that was early on until we could get a handle on that. And so there are some residual things related to health equity that still remain. So because we're trying to, as our mission is to eliminate discrimination and eliminate some of the disparities in the health outcomes for individuals who actually get COVID too. So hopefully that answers your question.
I think you did. Thank you very much.
Sure.
Thank you. Are there any other questions? Well, thank you, ladies. Thank you for your testimony, and we look forward to getting together later on and talking about some of the aspects of your hiring and things like that. So
Absolutely.
thank
Thank
you.
you for having us.
Thank you.
Okay, have a good day.
You
Thank
too. Bye-bye.
Okay. Moving right along. Department of Consumer Protection. Good morning. We're 2 minutes ahead of time. Come on in. Yes.
So, good morning. You ready for me?
Just 1 second.
All right.
All right, is your microphone on?
Yes.
Okay, great. Go right ahead.
All right. Well, good morning. Thank you for having me. I'm Michelle Siegel, Commissioner for the Department of Consumer Protection. I'm here to, testify in support of the governor's budget and to answer any questions you have at a high level. You have our written testimony, but, this budget maintains the positions DCP currently has, in addition to moving the cannabis positions onto the general fund, and it provides support for the prescription monitoring program, which has been a program that's been at DCP for quite a while and has been really important in combating the opioid epidemic, along with a lot of other has a lot of other healthcare benefits. But I'm happy to answer any questions.
Thank you, and thank you for coming before us today. I'm going to start right away and talk about the marijuana, the cannabis, adult recreational cannabis. Let me be clear. As I went through the budget, there were a lot of entries for cannabis in different agencies. They're all spread out, and you have a large amount here. I don't think that many of us in the General Assembly had the expectation that this was going to be an expense out of the general fund, that this was going to be something that it was going to be self-sustaining. And each year it doesn't get, well, only 2 years, but last year was a few, and this year it's a little bit more. At what point do you think we're going to be able to say the funds that we are collecting, the taxes that we're collecting for marijuana can sustain its own operations?
Well, I think the revenue that's being brought in between licensing and tax will already be greater than the expenses. It's just a lot of the revenue that's coming in is intended to support social equity and be reinvested in communities that were disproportionately impacted by the war on drugs. So there was a lot of expectations that the revenue and the sort of that comes to the state from the program would go to other purposes and not necessarily state salaries. And so I think you would already have probably a point in time, we've had probably 50 to 60 million in just licensing revenues come in from licensing fees.
So I guess on that note, the social equity, from what I've been told, we'll talk about that with that group, that is only operating with $5 million access at this year. I don't know why. But then if we've got an excess of revenue of 55 million, again, I go back to, and I this is probably not your well, this is ours because we make those determinations. But again, the purpose was to have it self-sustaining. And we need to look at that. And I understand there's startup costs, but the startup costs still go well within the amount that we are collecting for the adult cannabis. So I guess I'm sort of venting. I should be saying I'm venting because as I go through the budget, and yes, the social equity was supposed to help spread it out to but it's not that much. And yet we're taking out more out of the general fund to pay for adult cannabis than we are putting into the community. So we're defeating our own purposes on the first year, and why we did this and what the whole purpose was. So I guess I wanted to put that out. In the general fund, you have, according to the sheets that we have from OFA and OPM, the governor's recommending 282 positions for you. In total, it's an increase of about 30 positions. How many positions do you have currently?
So right now these are general fund positions, so I don't always match exactly what goes with what, but
Nobody does.
yeah,
so
yeah.
don't feel bad.
So overall, when we're completed with our hiring, we're going to have about 300 positions. Right now, we've got about 236 that are filled. So we've got roughly another 60 or so, but this most of the positions, so from the general fund, we've got about 24 vacancies that we're working to fill, but then we also have cannabis positions, another 25, 26, and then almost 9 or 10 related to the online gaming that we're working to fill. So between all of that, we've got a roughly 60 sort of in a pipeline somewhere.
That are in the process. Okay.
Yes.
Have you had a problem with filling positions within a timely manner? Is this a 6-month voyage for you per position, or is it 9 months? Is it a year?
It varies. I mean, certainly, I think as you're hearing probably from a lot of agencies, it's hiring is a struggle. It's not necessarily just the hiring process. And we had the retirement wave, plus we were doing significant amount of hiring between online gaming and cannabis. Both new programs came to us at almost the same time that we also had a retirement wave. So it's compounded our challenges. So it's hard to know exactly, because this has provided a good opportunity. So for a lot of people who've worked at the agency to maybe get a promotion or move into a different division to do some different work. But of course, when somebody moves up into a new role, well, now their position becomes vacant. So we can spend a long time hiring without actually changing our head count because of that. And so, and then you may get to the end of the hiring phase and you need to, hire 3 or 4 attorneys, or you need to hire a number of, drug control people. And a lot of them don't end up accepting the positions. So you then have to start over again because of that. So maybe you wanted to fill 4 and you only end up with 2. So now you're back to the drawing board, or if one of them was a promotion, now you've got to backfill. So it's hard to say exactly how long from when it's posted, because it varies. Are you going outside the agency? An internal promotion may go very quickly, but it doesn't ultimately get us new net human people.
Okay. The gaming portion of your budget, I understand it doesn't seem to have taken off the way we thought it was. How are the revenues going with the gaming right now?
We didn't really, the revenue projections on that were sort of outside what DCP was doing. So I can't speak to what people thought it would bring in. From our regulatory point of view, it's going smoothly.
Okay.
We've more or less staffed up. Some of the vacancies in gaming are people who've started and left or got some of these promotions that we're now backfilling. So in that regard, it's going as expected, but I can't speak to overall what everybody thought the revenue would be. And, some of it there's the tax revenue, and then there's the revenue from Connecticut Lottery and their piece of the gaming marketplace.
I think we had higher expectations in the amount of revenue that would come from the gaming, because Connecticut for 4 years had been going up and down with MGM and and everybody. So our expectations, I think, were a little bit higher, and then adult cannabis came in and went choo.
Yeah,
right past everything else. So
it's hard. It depends on how much, I guess, people gamble and
Yeah.
how those taxes play out. So
okay, thank you, Representative Chair.
Thank you, Madam Chair. So I want to kind of dig in a little bit to what Representative Walker was just saying. With the opens that you have, I'd like to understand historically where you guys are with opens, because I'm trying to figure out what's in your budget. If everything in your budget is an assumed 7-1 fully loaded head count, if you're tracking historically to having X amount of opens, then that's not a fair assumption, right? So I'm trying to figure that part out, and we don't really get that detail. So I'm hoping in the subcommittee, you guys can provide what your historical vacancies looks like, beginning and ending of the last few years, and what your hiring track looks like. And then in relation to the cannabis pieces, again, we're kind of on the same track here. This was really supposed to be self-sustaining, and it's littered all over the place, and you just happen to have a large number. So that means, we're going to look at your number a little bit more. If if we have the revenues for this, then the very first thing that should come out of it, in my opinion, is the staffing that we need, and then everything else. So my concern is if we're adding $6 million to your budget for cannabis regulation and employees, when do we get that back out? Because, you know, I'm one of those people who says once the government gets a tax dollar, they never give a tax dollar back. So I'm concerned about the 6 million bump.
So again, the cannabis revenue, it's already coming in from licensing fees. There's already, you know, at the market launching tax revenues coming in. So and it's the priorities of how that revenue is being spent. It's being prioritized on a lot of the social equity priorities. So it's not just community reinvestment. There's an accelerator program. There's staff at the Social Equity Council. There is workforce development. So there's a lot of sort of specific purposes benefiting the state more broadly, and to allow that money to go fully into supporting those other priorities. The positions at DCP were being moved to the general fund. It's also, it may be helpful to understand the way we're organized. It's not like there were some people who pretty much do only cannabis, but we have a lot of people who do cannabis as part of their job. They may be an attorney and they support our drug control division more broadly. And so they're doing cannabis work, but they may also be doing regulations over pharmacies. So there's
ways to, you know, I've been in the business world for a long time. So, you know, there's ways to allocate funds if there are people that are.
Yeah, so we could
are
certainly,
using pieces and bits. My point is, this was passed with the intent that it was going to be a self-contained area. So if the revenues are there, then we should also have the expenses there and net it all in one area, flow that down, and then use that money, right? So then it's truly just an investment for people, and the taxpayers aren't picking up this portion of it while the revenue is only going certain places, right? It should be self-contained. I think that was the intent. And that's kind of what I'm looking for, is this should be a self-contained expense revenue. And then the money that is left goes out for all the social equity things that we wanted to do, because then it's truly just a benefit to the taxpayers, and it's not an offset, an increase, right? So I think that's something more philosophical outside of what you do. I think that's something that we have to talk about and discuss and look to maybe change that regulation so it falls in line specifically with what it should be. But in that case, if we do that, then this $6 million it's overinflated in your area, because it should allocate. Like, you can have the dollars there, but then the allocation should come off and hit the revenue over there. So I think that's something that, again, I don't think that's something we can really do with you. I think the people back here have to kind of do that. I think that was really the main question that I had. Definitely, you know, especially with these larger FTE pools, I'm really going to want to, in the subcommittee meetings, understand your vacancies, understand how your agency floats vacancies for the last few years, and then understand exactly how your budget was built. If it's an assumption of a 7/1 start date for all of these, then we can look at kind of an average cost per employee and adjust. So,
okay.
thank you. Thank you, Madam Chair.
Thank you for being before us today, and Representative Nuccio and Representative Walker asked a bunch of my questions. But in regards to the prescription monitoring program, expand prescription monitoring program, hire 3 new employees. What is the increase in maintenance?
So there's a couple of things there. I mean, this has been something that DCP sort of took on as its own initiative over a decade ago. And we've really, between grant funds or sort of other places, pulled together money for a prescription monitoring program, which started off as a fairly voluntary thing with maybe weekly uploads, and has now become a really important tool in the healthcare environment. And so over time, it's become harder and harder to kind of keep up the grant funding and grow with the demands. You know, now there needs to be real-time uploads. There's mandatory lookups by physicians. It's become a much more robust program. And so moving it to the general fund, I think, is a way that this budget recognizes that this should be a legitimate state priority that the state is paying for, and that shouldn't be dependent on year after year DCP finding external sources for. The growth, so some of these are just positions that we've sort of over time been paying for wherever we can find some external resources, but also there have been some there's some legislation now contemplating expanding the prescription monitoring program, so it includes a broader range of drugs and not just the Schedule 2 through 5 that it currently has. And so if you were to expand it out, there's also, we're trying to do work to allow for more easy for it to merge more easily with the electronic records in doctors' offices, so it's not a separate login. So there's a lot within the system that we want to expand to make it easier to use and to make it more robust. So it kind of encompasses all of that.
When you say merge with doctor's office, can you explain that? Because I don't.
Well, they have their electronic medical records, and so some of it, this has already happened. So instead of having to separately look into a patient's records that the doctor's office has and then separately log into the prescription monitoring program to see the full patient history, if you can have it so that those two are synced up so that it's a single login for a medical office, for example. And so some of that is happening, but you know, it requires work with the vendor and other sort of fixes to make that a more seamless process.
So the actual job of the 3 employees are going to be inputting data, or what is
No,
the
we
actual?
do very little input. So the way that it works is if you're a doctor, you prescribe prescription for somebody. One, you have to look them up in the prescription monitoring program is if it's, you know, over a certain number of days. But so you would look it up to see what is the totality of the prescription medications that they're taking, so that you get a feel. Is there going to be drug interactions? Is there maybe a risk that somebody's drug shopping or doctor shopping? So there's that benefit. It's the information is uploaded into the system by typically the pharmacy, but whoever dispenses the product, it can certainly be at a hospital or a doctor's office, so that you know what drugs is, because sometimes somebody gets a prescription, they don't end up filling it or using it. So what DCP does is, one, there's a lot of now mandatory lookups and there's mandatory registrations. So we need to make sure that is all happening. It used to be a much more voluntary program. And there's been a lot of emphasis, especially with the opioid epidemic, of making sure doctors are doing that. We've done working with the system to create like a morphine equivalent, so that when doctors look in, they can get a feel for collectively the medications a patient's taking. So we have the enforcement. There's a lot of data analysis that needs to go into it.
Can you send us a printout of what the 3 employees are going to do?
Yeah, we
'Cause that
can
was a lot
send
of
you the
information.
details, because they do,
Yeah.
it'll be different things. Yeah.
Okay. And as far as going back to being self-sustained, well, actually, I'll change that. One of the good things about it going to the general fund might be a little bit more transparency. But with the numerous ways that money comes in to agencies, how do we see that? Like the general fund, it says, or I'm sorry, Representative Walker said earlier about the different areas that cannabis related funding was coming into different places.
So at DCP, the licensing revenues, that would come through us. So anybody, when they apply for a cannabis license, and it's both the businesses, employees, that comes through us. There's also the tax revenue piece of it, which would go through revenue services. And so we don't really have visibility into that part of it. So that's most of the revenue that comes to DCP is through our licensing, and that's where we track that. There's also some assessments that come to us. So for example, the gaming revenue, we assess the tribes and lottery for reimbursement of costs, and the flow of money in those areas goes through us.
So do you show a list of what comes in per county? Like,
Yeah, we have, you know, we break it down from, yeah, we can look at the different areas in which revenue comes through us to the general fund or elsewhere.
Is it by county or by the establishment in the county?
By what?
Like for when it comes in, when you get that list of areas throughout Connecticut, how do you list it?
I mean, it would, if it comes, we don't do it by geographic area, or we don't do it by position. It would be, so, you know, we could pull up the amount of revenue that came in from a cannabis licensing, or the money that came in through, we license you know, hundreds of other, you know, whether it's electricians, plumbers, et cetera. So we have a lot of licensing, so we can look at revenue that's coming in those different ways. Then there's, you know, the assessments we do for our gaming. So that's a very specific, separate process.
Okay. Thank you, Madam Chair.
Thank you. Are there any other questions? Okay, I have. Going on to the next part, right up, it's provide funding to expand the prescription monitoring program. Can you explain to me a little bit about what that is?
So part of that will be making this a more formal part of what the state is supporting. So it did start as something that DCP developed, you know, over a decade ago, kind of hobbling together grant funds or other sources. And truthfully, it's you know, every year or two, it becomes a challenge where we're not quite sure how we're going to support this. But it's become an increasingly important tool as a healthcare tool broadly, but in particular in dealing with the opioid epidemic. But there have been thoughts and ideas to expand it to include a broader range of drugs or medications that should be in there. Also, there's been increasing interest in making now the use of the system mandatory. So when we started it many, many years ago, it was really a voluntary system. Uploads happen weekly. Now it's pretty much real-time uploads. It's mandatory lookup. If you're a prescriber, you need to be registered with the system. And so it's become something that has a lot more requirements around it for us to enforce. There's a lot more interest in people understanding the data, understanding how many prescriptions are going out for different types of opioids, for example, or other drugs. So it's centered around all of the growth, both in the scope of the program and in the mandatory use of the program.
I guess the question that I have, first of all, I didn't know you guys, I mean, you are DPUC, but I mean, I didn't know that you monitored prescription drugs. I guess I was thinking that your monitoring was more of, well, I don't know. I don't know, but when I saw that, I was confused. I would have expected to see something like that in DPH or in maybe even DEMIS. So how long have you been monitoring prescription drug?
For as long as I can recall. So we regulate pharmacies and pharmacists. So we work very closely with DPH, for example, since they would license the doctor, but the controlled substance registration, which authorizes a doctor to actually prescribe.
You
monitor
that?
Yeah, so that comes through us. And so the prescription monitoring program is something, you know, it's been there for the 11, 12 years I've been at the agency. It has existed, and it started as something our drug control division recognized was something that would benefit from the state would benefit from. And through grant funding, sort of slowly developed first as this voluntary system that wasn't too robust, but sort of getting everybody used to it. And then as people began to more fully appreciate the value to the healthcare system, and then the opioid epidemic, and having that information, it's become much more of a tool. And so it makes sense to formally put it in the general fund.
So I guess how do you, okay, so you gather the information of who's doing this and everything. How do you convey that to Demas, who is working on addressing opioid addiction or thing? How is that conveyed to them, or how is it conveyed to DPH, who is also supposed to be I've got two sort of regulatory systems going on in the same area, and how do you guys communicate with each other the information and to what avail?
There's different ways. So certainly we have MOUs. We do some aggregate data sharing. We want to be cautious with the prescription monitoring program. It's primarily meant to be a tool to help doctors or prescribers to do their jobs better, to be able to look up a patient and understand the totality of the medications that they're taking. I mean, the reality is, especially somebody who may be sicker or have a lot going on, they may be seeing 3 or 4 specialists all are prescribing something, and you get there and they're like, oh, what drugs are you on? And you can't remember and you can't spell it. And so to be able to look it up and recognize the drug interactions that may be taking place, it would also be able to recognize as somebody on a lot of different opioids that this is a problem. A doctor could look up their own sort of records within there and see, is somebody prescribing stuff using my number when they shouldn't be? So we want to keep it as a tool for the health for doctors, but in terms, it certainly can be, if there was an investigative need, it could be a resource there as well.
Okay, I know, because I'm off my lane. I'm supposed to be talking about money, but
No worries.
the other part, this is an allocation in the budget, so I'm just letting my co-chair know that I am talking about money, just a different way, so that she doesn't say it's not your lane. But if you see Dr. Walker is writing prescriptions that are above and beyond what her scope should be, how do you convey that to and who do you convey that to? Because that would be DPH, right?
Certainly, if there was reason to believe that a doctor was misusing their prescribing ability, we would work with DPH on that.
Okay.
It's not necessarily something you would pull from the prescription monitoring program, because there's some specialties. If you specialize in treating cancer patients, we expect you're going to be prescribing an above average amount of painkillers, and that's reasonable. So there's always the caution of not discouraging doctors from appropriately prescribing and making them think that Big Brother is looking in on them, and if they go too far. So it's a balance, but we work closely with DPH.
I guess my final statement, though, is that I'm not in opposition for what you're doing. We have so many freaking silos in the state, and we have opportunities to share things like this that help us stop other atrocities happening. What's the methodology that we're using? And don't explain anymore, because I don't want to get yelled at. But I really want to follow up on this, because I'm not saying it's bad. I just want to see a clear communication so that what you're doing is good. Thank you. So are there any more questions or anything? Representative, I think I stirred her up.
She did. Rep Walker and I are like, we're symbiotic this morning. It's, this is a good thing. So I actually had this marked and I didn't turn the page to ask the question, but in relation to this, I'm a fan of the idea of it, but I guess my question is, you're asking for 3 people, and I'm wondering, how are we actively, this sounds like a passive database, right? So everybody puts everything in, and a provider or a pharmacist has the ability to look at it. But what are the 3 people going to do, and how do we turn this from passive to active, right? So I know my husband just had a surgery, and the amount of meds that he was prescribed was ridiculous. And trying to get that coordination, how do we make this active and not passive? And is that in your area? And what will these 3 people be doing with the database?
So, I mean, it is being used actively by the healthcare community. So just to be clear, so we do, one is making sure people are using it. So that's a big piece. So, if you were going to prescribe medication, you need to be registered with us. So making sure that all the prescribers do that is part of it. You're required to look somebody up, so that if someone like your husband now goes to another doctor, they should be looking up before they prescribe more medication to make sure it's not going to either become too much in a certain category, or it's not going to interact in a way that's unhelpful to flag things. So we have to be involved in making sure that's happening. We do a lot of aggregate data, and we provide that. We do work closely with with DPH and others in making sure the system is functioning as this healthcare tool. But I think there's clearly, we're happy to sit down with our drug control director and sort of walk through how all this works. But there's a lot of data analysis, not in the sense of going after an individual person, but in terms of understanding largely what is happening in our healthcare system with prescription drugs. There's a lot of work in making sure that, medical doctors' offices, hospitals are able to more seamlessly work within our system. We end up getting a lot of questions about that. So there's a variety of different work, and there's a lot of training that needs to be done. This really did start out as this voluntary thing that not a lot of people were using, and it's over the last few years, it's evolved into something that we really need people to use and to use correctly. So there's some of that as well.
I think that's the part that I'm getting at, and listening to you, like doctors should be looking at this, we want them to look at this. That to me is passive, right? Instead of trying to find a way to ensure that they are, because I understand the aggregate data. We're looking at prescriptions, we're looking at opioids, we're looking at usage throughout the state and stuff like that. But my concern is the coordination of care and making sure that the providers are looking at this data and the pharmacists are looking at it. And I guess, so what are the three people that you want? What are you looking to do with the three people?
Some of them are here, and just to be clear, that it is mandatory, these lookups in these downloads. So some of it is doing the investigations, taking enforcement actions when we learn somebody's out there prescribing drugs, not doing that. We obviously can't be in every doctor's office to literally make sure they're doing it. So some of it is that work. It's the training, it's the data analysis, and it's the enforcement. But we can meet offline to really go through in much more detail, like what I can't tell you day to day the exact work these three people would be doing, but broadly those are the buckets it would be in.
And in this line, the personnel services, the other expenses is significantly higher than the personnel services. Can you give me an idea of what's in that number?
That is the prescription monitoring program is the big
that's the actual
increase. It's
program.
right, because it's we have an outside vendor, and this has, as it's grown and as we've required more of the vendor and required more people to be involved in the system, the maintenance of the system has gone up and up. Like, what you don't want is all of a sudden this thing going down for a week and now doctors have no idea what's going on. So there's a lot of vendor costs associated with it, and this just moves that to a more predictable and stable funding source, so we're not every year worried that we could lose it.
Okay, and do you know if this might be outside of this, but do you know if the state is using any part of like the opioid settlement, the revenue, the money that the state will be getting for that to offset some of these costs?
I don't believe that money's going to the prescription monitoring program. Yeah, no. So I think that's more going toward.
That might be a good place to, yeah. All right. Okay. Thank you very much.
No, thank you.
Thank you. You have a question?
One question. Very quick.
Mhm.
So you have money that comes in from the two casinos that pays for their costs to your looking over their shoulders. And you have, we're setting up the cannabis sort of similarly to that. Are there any other entities that pay directly for your regulatory services?
Well, the Connecticut Lottery Corporation is assessed as well, but otherwise really outside of gaming, our positions, we have some grants or other things, but our Lemon Law program is another one, but that's very, very small. It's only a few people, and that's fees.
Yes.
So that's the new cars. So we get some revenue from that, and we use that to run an arbitration program for people who buy a new car that turns out to be a lemon. But that's a very small piece of what we do at the agency.
Where does that money come from?
So new dealers have to pay for a certain fee it's collected, I believe through DMV, but it comes to us to cover those costs. And then we have a couple of people to help run that arbitration program. But more or less outside of gaming, it's really general fund is our positions.
Okay, thank you. Thank you, Madam Chair.
Go right ahead.
Thank you, Madam Chair.
Mhm.
Just not to belabor the point about the three positions, but what do you know the job titles that those people would be coming on as? Can you share that?
Well, I believe they're there. These are just now moving them from, I can't remember the exact job titles, the way it's within our drug control division, but I'm not, probably a health care associate's going to be one of them. But I'm not 100% sure the exact titles. So we would need to get back to you. We can go through, these are the three people and these are the specifics of what they do.
Okay, I'm married into a pharmacist family, so I know your agency has a lot to do with it. Thank you very much.
Thank you.
Thank you. Thank you. And thank you, everybody. Thank you for your testimony.
Thank you.
Hey, Mo. Next, we have the Office of Healthcare Advocate. Well, I'm just going to. We lost the 2 minutes, by the way. Okay, there we go. I know, it was the prescription monitoring. Good morning.
Good morning, Representative Walker.
You have can you pull the microphone a little closer to you so we can? There you go.
How's that?
That's much better.
Okay.
Go right ahead.
My name is Ted Doolittle. I'm the head of the State Office of the Healthcare Advocate. We are what I call sometimes jokingly the best kept secret in state government. We have a team of nurses, attorneys, paralegals, and others who can help folks who are having any type of challenge with their health coverage. That can be a public plan like Medicare or Medicaid, Husky, or it can be the plan you get through your work, or even something slightly off the beaten track like a healthcare sharing ministry or association health plan. Any way you get your healthcare funded, we have a staff that can advise you from something simple like trying to get that address changed so that the bill gets to your new apartment, on up to trying to get complex cancer care covered for your child who has been sick for many years. So anything from the mundane to the complex. We hear we have about 5,000 complaints per year. That is going up, actually, perhaps exponentially. I did want this to draw to the committee's attention that as part of the child mental health bills that passed in the last session, particularly Public Act 22-47, the healthcare insurance companies, when they issue a claim denial, we're already required to put our name and address in that for the consumers to find. It usually wound up in the boilerplate back near the alternative languages. And 2247 required that notice to be put in language that my office approves on the very front page of a denial. And that just went effective on January 1st. And obviously that's a fresh law and a new program. But I'm happy to report that we've seen a definite uptick in our cases, and we'll keep an eye on that and keep you apprised as the caseload emerges. Many of you are familiar with the agency from having referred constituents to us, and we hope you and your colleagues continue to do that. I think our budget presentation is quite simple. We have 18 folks on staff. The budget is about $3.5 million. I don't think there's any surprises. I know the committee's been inquiring about vacancies. At this point, we have 2 vacancies. One is a staff attorney vacancy that is posted right now, and the second is a paralegal vacancy that should be posted, I hope, next week.
Well, you got that quickly. Thank you very much for, yes, thank you very much for providing us with that information. So I want to go back to what you brought to our attention. So the volume now is picked up because of the fact that we have a disclosure statement that's put into all the denial forms now. Is that correct?
There always was the notification. Now it's more prominently placed and in very brief language that my office approves. So it's right on the front page. So I sense that the volume is picking up, right? But it takes a while for a person to go get care and then the bill to come out and the claim to be denied. So now we're only in February for a law that just started in January 1st. And also it is quite possible that some of the companies weren't exactly ready on January 1st to update their forms. So I'm just giving you a heads up that I sense that there's an uptick. I can't tie it directly back at this point because it's just been a few weeks to the new law, but I wanted you to be aware in case there is a volume uptick. We'll be coming back to you explaining the dimensions of any increased caseload.
It would be really beneficial if you could try and, let us know before the second week in March.
Yeah.
So that, we obviously don't want you to get overwhelmed and
Right.
not have the staffing. If you see over the next few months that this is happening, we're glad. We want people to know who you are, and
Right.
we want people to because a lot of people feel extremely desperate and sort of, dropped off the face of the earth in some ways because they've got some serious bills that come from healthcare. It is
Yeah.
not cheap, but I appreciate that. I also know that there are a lot of people who, when they go into the state funded programs, a lot of them are hitting walls too. And I'm hearing that from some of my constituents where they thought certain items were being paid for that they aren't. And pretty much I have a lot of people that communicate to me, then why do I need this insurance? So I'm sure you're also getting that type of inquiries from your office. Is that correct?
Yeah, absolutely. And of course, as you hear from your constituents, please remember to refer them to us. It's a free service of the state of Connecticut, and it's really a hidden gem. So keep those referrals coming our way.
Thank you. Senator Austin.
Thank you very much. First, I want to thank you for what you do because my office uses you regularly.
Sure.
And it's, you are right. It's a very helpful because we have people, most recently, I had someone who needed hospice care and was not being covered based on their status. And ultimately, it appears today that situation has been resolved, but that's the kind of thing that I've found that you have been able to handle so regularly, or someone who needed a pump for insulin on a child and they had no ability to get it through their insurance wasn't covering that. You were able to help out with that. Those are things that are life-changing to constituents. Now, my question is relative to who funds the Office of the Healthcare Advocate. It's entirely funded by the insurance fund?
Yes.
And as a result of that, this has no general fund implications at all.
I believe that's true. Yeah.
Okay. And so I think that's interesting because I think a lot of people don't know that the Healthcare Advocate is actually funded by a assessment onto insurance providers broadly.
Right.
And so I wanted to make sure that was a little bit more open. I have no other questions for you, and I just want to thank you and your staff because they have clearly helped people out of very awful conditions, and it's been a life-changing event for a lot of people. So thank you very much. Thank you, Madam Chair.
It's just so sad that right at the moment when they or a loved one is ill or injured, that's when you face the red tape, and that's when you face the financial burden. So that's not every state has this type of office. About 4 or 5 have really robust offices like this, and I just wish it were national because you shouldn't have to worry alone. You shouldn't have to fight the bureaucracy on your own.
Right. Thank you so much. Thank you, Madam Chair.
Thank you, Representative. Okay. Senator Marks.
Thank you, Madam Chair. So I don't have a question, I just have a comment. As a freshman senator, I did not know about this office. And as a visiting nurse, I think I can guarantee that right now you will have an increase in referrals because I am going to make sure I can think of so many different cases where I was like, wow, I wish I had known about this. And I will make sure I let all of my peers know as well. So I just want to thank you for what you do. As somebody who has had to fight with insurance companies, because I had a daughter with a cleft lip and palate for 20 years, I fought with them. That I wish you were there when I needed you. So thank you so much.
Yeah, well, I appreciate the comment, and that's why we wanted to get that enhanced notification on the front page. And I can share with the committee the actual language that we provided, but the first words that are now required is, "This is an insurance denial," because so often you can't even tell that, from the way it's phrased. You don't understand what it is, and I hope that the passage of 2247 last time will try to make an impact on what I, again, jokingly call the status as the best kept secret in state government. I'm hoping that when people see denial after denial and it's right up front, it'll slowly start to sink in, and they'll realize, because there are so many folks like Senator Marks who wish they had known. And so going forward, we're trying to solve that with your help.
Thank you. Representative Exum.
Good morning. Thank you so much. I just wanted to comment that I'm really happy to hear that you're seeing an uptick because of that change. And we were really happy to learn about it. For me, it was very new to learn about it through the writing of the children's mental health legislation, where you were able to provide. And I'm curious, when you said that you get about 5,000 complaints, what are there trends? Are you saying, I know this is a little bit off budget talk, but we're moving quickly on that. So I'm curious. Is there a trend as to what types of complaints you typically get, or is it really all over the place?
Well, it goes with the flows of what is happening in our state and in our country. For instance, when the ACA passed, the next 24 months, it was double or triple the volume, because people didn't understand. It was new. They needed counseling. They needed advice. So things change as the ACA changes. Now people are much more used to it, so they understand what the marketplace is. So that has gone down a little bit. One consistent theme, and this goes actually along with 2247 from last session, is that a large chunk of our cases are behavioral health cases, and they tend to be weighted also toward adolescents and children. So that's what made the perfect marriage between the enhanced notifications and your bills from last session.
Wonderful. Thank you. I'm happy to hear that. And I think it's also speaks to our priorities as we plan, understanding where the trends are. So thank you so much. And I look forward to hopefully hearing from you by, as you said, by March, if we need to make some adjustments.
Well, thank you for your comments. And might I say, I'm one of your constituents, so pleased to see your interest in the topic.
Thank you. Thank you.
Thank you. Thank you. Are there any questions? Thank you. That was fantastic, and have a good morning and afternoon. That's it.
Could I just, housekeeping detail?
Uh-huh.
I noticed my agency was also on later in the afternoon. Was that a glitch, or do you need me back here in the afternoon?
No, you don't have to come back. Go ahead. Yeah.
Okay. Okay.
You're good. You don't-
I'm at your beck
I mean,
and
you can
call.
come hang out with us if you
Yeah.
like, but most people don't want to. Yeah.
Exactly. Okay.
Yeah.
Well, thank you.
Thank you.
Yeah.
Tammy, yeah. Thank you,
Great.
sir. Thank you for your work and your service for the people in Connecticut.
Thanks for
Thank
your
you.
service, folks. Appreciate it.
Bye-bye.
Thanks.
Well, we are now concluded the morning hearings, and we will now go recess until 1 o'clock, where we will hear Military Department, Department of Emergency Services, Insurance Company, Workman's Compensation, and Banking Department. So we will reconvene at 1 o'clock. Thank you.
Happy birthday.
Thank you.
Everybody know it's Tony's birthday today?
Oh, yeah, it's your birthday.
I have talked to my office.
Right. Right now.
No. Really important.
No.
We just stopped singing because.
Yeah.
Oh, it's a little different now. It's, I knew they were figuring out this. No. Okay. The Zoom at 1 o'clock. It only takes so much for a budgetary. Yeah. Oh, I don't know. Yeah, well. just go up and sit in the front when the. Don't leave on to. We can take it with nobody's before us. We can. Oh, yeah. Sit right here. Take the front. No.
Separate those Fed people from the good old state. Hard working America.
I've actually been on this committee, I'm doing this Wi-Fi issues in this. Yeah, but. No.
So we got out. Yeah. There's a bunch of.
No, 24. So they keep changing everything. June version. Won't be available. Well, I just-
Well, okay, this gets ready to do this.
Not that they're really nice.
So we'll go back to that.
And leave time is gonna be 2 years. So. Yeah, you learned.
We have them all.
All right. Wondering you might.
They're making awesome.
Pre-put on. No, mine either. Those are both. I'm really sure. Yeah, I'm good.
Oh, you know what? You can't see that.
One of those two?
Yeah, online. Yes.
Oh, okay.
Hopefully the mic's not hot.
That's why those guys are sitting downstairs.
Yeah.
Yeah.
I think now.
Excellent.
Sergeant
Sergeant
Exum? Oh, maybe.
I forget. I might be wrong, so don't quote me on that. But I remember seeing something to that effect.
Quite a while ago.
Yeah.
So how does this, well, what, when they
They'll-
come in,
they'll-
what happens?
They do some initial like parliamentary procedure, they call the
Housekeeping.
meeting to order.
Okay,
They introduce themselves, say what they're here for, and then they'll turn it over to the for brief introductory remarks, and then they just want to part.
okay.
Or they will provide questions. So oftentimes, like, this is at least in recent years. It's not like,
Yeah.
like committee members or.
Anybody?
Well, they also have a live,
Most activity over here.
And it's not.
Yeah, we're sure they're most of the job, but there's some big stuff. There's a ton of press activity.
Oh, yeah, there was.
Yes, sir.
We're kind of.
yeah. He'll signal twice if.
Yeah.
For a bunch.
I haven't been here every year. Maybe it's what I've been working here a dozen years, 4 times, and I think only once. His predecessor returned to me and said, roughly, I've been here. That was it. Time I just sat here.
Yes, I've never been.
We need this amount of money. We want to do it. Thank you very much. Exactly. All right. Once. Meaning more.
Yeah,
absolutely. Next group testifying.
also it's not outside of.
Yeah, they're good. It's not usually. Like Eric was saying. Sometimes you don't even get all of that.
Oh.
Which is frustrating.
Mhm.
Who asked? I don't know if she'll put on, she'll make it connected, that always.
No, yeah, yes.
For this
I'm-
job. We got a place to be. Some of them
Most
are.
of them.
These are higher state.
Hmm.
Yeah, the opposite. Yeah. That might be the sharpshooter.
Yeah.
So, they called us. Every.
Oh, yeah.
So.
Oh, really?
So I don't go along the side. Plug with him.
Yeah.
He's perfect. So I completely abuse that opportunity. You see it. Is it
Which one?
I know where his brother name.
Okay, yeah, yeah. It was-
Yeah.
Yeah, yeah.
Um,
There we go. They, both one of them.
Oh, they did. Yeah. Oh, it's not a car, but it's stuff.
Oh.
Yeah.
Trigo pizza. It's worth it.
Yeah.
Yeah, yeah,
You're
yeah.
supposed to text me when they opened it.
Yeah, yeah. Trigo's got it open. They're open at Wednesday.
Awesome. Well. Pretty fresh. They had a long time.
Oh, yeah, 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 yeah.
She's
No
like,
problem.
it's kind of-
He took
a while.
It's down there.
So,
And it's back.
yeah, the last time I talked to them, and they're not ready yet. So they probably, they know where they some idea, but not really, right? You know,
Depending on what you did, right? She
Exactly.
may not.
Yes. And
So Caprio should definitely know what he was like.
yeah, yeah, he's all. From Bill's. No, well, so Bill used to bond with his parents, but he's, I think he didn't trust it. This might as well be married.
Yeah.
Ever.
They offered it to me.
Yes, yes, now she is, little bit.
Yeah, yeah. Well, like.
No, oh, yeah.
Really good, yeah.
And he provides photos for technology.
Oh.
You know, so the Lebanon diet.
Oh, yeah.
That's his purpose. So he bought a house that's now, he passed the fire, or the county, county yard, you know, the yard.
Oh, yeah.
And turned out to go to the Sure.
Turned it off. Oh, okay. So come out.
Yeah.
How
are you?
Hanging in there?
So he moved his operation there. And I always have.
Oh, the ball. It would be loud out here because.
Today we had an accident. Hit us on.
Mhm.
And probably said, "Oh, see on TV." Thanks.
Yeah, text my daughter, I asked her, who was gonna be on TV, I have no idea. Yeah, saw the sign, I text her, web address.
Yep.
My in-laws driveway.
I like that. Oh, is that on my bed? I got you.
That side.
They have the big tree that's in. Yeah, actually, it's a good spot where you can see my spot.
Right on that angle. Yeah. You know what's terrible? Pretty fucking money.
I didn't know they were gonna have.
Yeah.
I spent.
What's tighter?
No, it's
Something like that. I'm just trying to think of those two FTEs.
But that's not, it's not in court.
That's what I mean.
Yeah.
That's what I come up with 39. They're saying we got 41.
That would authorize,
To authorize, debt, but why doesn't?
because we didn't create those positions.
Oh.
Yeah, so we just have to
So then,
add jobs.
instead of really 13 vacancies. we have to-
Yeah,
So this is key, right?
and we're paid
Okay.
for 40, so.
Right, but
Okay.
it's up to us now as an agency to lobby OPM/DAS. This is what we'd like to fill, right? You know,
We don't have to lobby anybody, we just put it in the form, she said.
Say where's that?
there's no process that we have to like.
Well, I mean, a
pay
regular room.
That's what I mean, yeah.
Yeah.
That's what I'm getting. at.
Between- Yeah, we don't have
You know.
to ask for PM because we're at 4,800.
Right.
Different. Positions.
I just, but there's still that process.
There's still, yeah.
The regular
less of a
process.
Less of a process.
That's what I'm
So,
saying.
yeah,
It's not like we have to ask for
we're a couple steps ahead. of it.
additional FTEs, additional.
Right,
Exactly.
right.
We
We have to figure out what we're gonna do. with it.
what are we doing with
We're
this?
gonna do it.
And you establish the position. Right.
Well, that's the thing, is it's really hard. So we're ahead of the game. That's it.
Yeah.
Probably close to 2. Yeah.
So that was part of the discussion, right? And it's a good valid point, right? Because it's like this has been shown, and it's the cheapest. However, and I'm just I'm not making a case either way or another, but he also has the responsibility of that side of the house, which is several thousand people. So if there was a
Second
chief
choice.
of staff, or deputy of something, you know, he could alleviate some of his pressures. But I don't know how much pressure.
Yeah. Right, right.
And I guess at the time they might decide, well, no, they're fine.
Very more.
Yes, okay. So that says,
So, yeah.
that says he's not.
Yeah, he's getting.
Yeah, so he's not.
Oh, yeah.
Is this a public?
Right.
But, I would say smaller than probably we need. Right, it's that. Move some people, or what's the name of your associate assistant, whatever.
Whatever the.
Whatever the
the
job,
pay is.
being one.
Right.
I should have guessed that.
If I have to go out.
You go out, you drop dead.
Yeah.
No, no. offense,
If I have bus,
you know,
right.
by a bus, or you know what?
And you know, when we sent.
I got a great office.
Question for Jacqueline to have that role and said no, because it's like an HR.
Right.
We only have one HR.
Right.
You know
Right.
what I mean?
So we- Yeah.
So.
Yeah,
Or
or it's like,
Be on both sides of the.
right.
Right.
You get an offer.
We have a house.
Stay outranked, right?
Yeah.
That's Mike's fortune.
Yeah.
People, yeah.
It's.
I mean, we just have to learn. The line can cover down a little bit.
Yeah.
Someone's hurt.
Right.
But there's still.
You ready? You
Yeah.
gotta go.
Like we just. we-
Good afternoon. I want to welcome everybody for the second half of the Regulation Protection Subcommittee Agency presentations. Now we are going to have the afternoon. We're going to have the Military Department, Department of Emergency Services and Public Protection, Insurance Department, Workers' Compensation Commission, and Banking Department. So first we have the military. Good afternoon, sir. Come right up. You want to bring any more people up with you? Yeah, you can go. Could you turn your microphone on too? please? There
Here we go.
there you go.
Senator Austin, Representative Walker, Representative Nolan. Good afternoon, and members of the Regulation and Protection Subcommittee. As most of you know, and thanks for those of you that we saw a couple of days ago, I truly appreciate you taking your time and breaking from a busy day to get across the street. But I'm Major General Fran Yvonne, the Adjutant General of the Connecticut National Guard and the Commissioner of the Connecticut Military Department. And brought a bunch of folks here today. Really wanted to take an opportunity, kind of like a broadening experience, especially after the last 3 years when we couldn't do this in person. But to my right is Major Eric Heinonen. He's a JAG and our legislative liaison. We've got Matt Wilkinson. He's our facilities maintenance officer on the Army National Guard side. Corey Nick is our base engineer from the Air Guard up in East Granby. And then we've got Mike Carriger. He handles all of our financial affairs. One of our newest members of the team is Erica Blackman. She's our chief of HRO. And Russ Bonacorso, who's our military admin program specialist. So appreciate the opportunity to meet and discuss our agency's budget. We have supplied written testimony, and the military budget is adequate to administer the Connecticut National Guard and the state military programs. I want to quickly highlight that the governor's proposed budget this year included an expansion of $129,600 in each of the next 2 fiscal years to support our recruiting efforts. As some of you already heard me say in the past, recruiting qualified young men and women into the Connecticut National Guard is currently our #1 challenge. In order for the governor or the president to be able to call on Connecticut's home team in times of domestic emergency or in times of crisis, our nation, needs qualified and motivated citizens to join our team. The agency's goal is pretty simple, although harder to execute, but the goal is that we would like every Connecticut resident 18 to 24 years old, regardless of gender, race, ethnicity, color, or sexuality, to be informed of the opportunities and the pathway that the Connecticut National Guard has, including technical skill training, educational benefits, leadership development, access to healthcare, and holistic health programs. Again, thank you for your time. I and a member of our staff are ready to answer any questions that you have. Thank you.
Thank you, sir, and thank you for your whole team to be here to discuss with us a variety of different things. So I'm going to start with your staff count.
Okay,
Can you tell me what is
absolutely.
your current staff count, and how many are filled positions, and how many are positions that?
Absolutely. So we're unique in that we have 118 authorized and funded positions. Of the 118, 27 positions are true 100% state funded. The balance of those positions have a federal state match, whether it's 70-25 or 50-50. But the bottom line is we have 105 filled currently. We have 13 vacancies. 5 of those vacancies are actually well within. We have hiring, and actually 5 of the vacancies are just pending their start date, and then the other 8 are pretty active in the procurement and hiring process. So we're in great shape. Quite honestly, we had 15 retirements last year. We've had 39 different positions that turned over, but it was an opportunity. I see it as a real positive for the agency, because we're a small agency. We had experience from outside, experience from other agencies that were able to come in. Erica Blackman is one of those examples sitting behind me. She came in and revamped our whole HR process, and we're having some pretty positive results for a small out-of-scope agency.
So you have 105?
We have 105 of the 118, 105 filled.
Okay.
118 are authorized.
Okay.
And those 13 are 5 of the 13 vacancies are already hired, pretty much pending the start date. And then the other 8 are in the process.
I was just going to ask them. So we have on our sheets 41.
So that's the FTE discussion.
Okay.
That gets a little more complicated. I like to talk real numbers,
Okay.
if that makes sense.
Okay. Yeah.
It's just easier to comprehend. We war gamed before we walked across the street. And I've probably got about 3 different opinions on the FTEs. Does that make sense?
Yeah.
Senator?
No. So 41 are paid by the state and the remainder are paid by the federal?
No, that's not the way it works. So all 41 will be executed this fiscal year.
Yeah.
41 FTEs encompass the 118 total. So I
got
can have multiple positions within.
Yep.
Multiple FTEs. There may be 2 or 3 in the same FTE,
Right.
like our FAO, our physical administrative officer. I
Okay.
think I have 3 of those, but that would only account for 1 FTE,
I got
if
it.
that makes sense.
Yeah, that does. So of the 118, it's 41 in FTE. Okay,
Right.
all right, I got that. Okay,
And again, the other highlight is 27 true state employees. So we have the majority of our force, even the majority of that 118 is federally funded.
okay, all right, thank you. Senator Austin?
Thank you. And General, could you have someone give us a layout of those 118 positions,
Absolutely.
federal, how they feed in to all of that? That would be very helpful. I think it would be a good
We'll send it over for sure.
discussion
Absolutely.
for us to have. So I noticed on here that you have the funding for the wartime service bonuses. Have those gone out? Or this is going to be an increase for wartime service?
So those numbers are based on our deployment cycle. So and every year we update that. So based on the projected and future mobilizations, we're very confident that we will be able to fulfill all the obligations. And if there was any point in time where we couldn't, and that has not ever happened, to my knowledge, we always go back to OPM and request additional funding for that. But that number is based on future deployments that we're projecting going forward.
And the pandemic pay that we put in the budget a couple of years ago, do you know if that's rolled out to your members at all?
I do not believe it is, ma'am.
Do you know if that's in discussion to be done?
I really haven't had an update. I'd have to go back and check on that.
Okay, great. And the military funeral honors program, is that enough in there?
3,500 a year we average, and that funding is definitely not short at all. We feel we're comfortable with that as well.
3,500 funerals.
Funerals, yes, sir. Yes, ma'am.
Thank you for that. Thank you, Madam Chair.
Questions? Yes. Representative Noah?
Good afternoon. Thank you for coming before us and thank you for coming before us, and definitely want to thank you for your service and the continued service of support that your folk do for us. I just wanted to hit on the area that you talk about when it comes to the STEM technology, engineering, and mathematics trailer and the ASVAB, because I know for a long time ASVAB has been a test that we give our kids that has been a struggle, and how what you're doing here is going to impact the state. Could you elaborate on that a little bit?
Absolutely. That's a great question, sir. I appreciate it. So the reality of the times we live in now is 71% of the 18 to 24-year-olds are basically ineligible for service. And that could be from a myriad of different issues, whether it's obesity, whether it's a criminal record, whether it's no high school diploma, whether it's mental health or even physical health issues that deem that population ineligible to serve. We feel, and last week down in DC with my peers from the 54 states and territories, that's definitely a risk to national security because, as you've seen, especially over the last couple of weeks, we still live in a pretty volatile world. But to specifically answer your question, we're very grateful to the additional funding in the next two-year budget cycle. We're going to use that specifically to assist with ASFAB improvement. So we currently have individuals who are willing to join our formation, but are not able to pass the ASFAB test. We've taken our citizen soldiers and airmen who are teachers in their civilian careers. This funding will be able to help us, and we're already instituted. We bring them in to teach
pay them state active duty. So we bring teachers in that are guardsmen. They're teaching these young kids on ASVAB improvement. Day 4, they take the test, and we've seen a very, very successful rate. And it's definitely money we feel well spent. The Army has done a similar program. We like to say that our program we initiated first because we had the ability to bring in those teachers. But the Army has a track where they're bringing kids in that are obese, and they get 90 days to kind of get in shape, lose some weight, and meet the body fat requirements. And the other track to that is that they bring them in and they're basically doing the same thing that we are, giving them some opportunity for additional training so that they can pass the test. They have seen some success as well. But we're really lucky that we have that state active duty opportunity to bring our folks in and get after the problem. With regards to the STEM trailer, that not only helps our marketing and branding from a National Guard standpoint, but in that trailer, there's a 3D printer. We have an instructor there that takes members or kids through coding. At the end of it, they code and they program a robot to give some tasks. There's aerodynamics there. They run through the ratios, and we see that as an asset that can help us get in front of high school students and not only get them excited about STEM, but that get them excited to serve this great state and our nation.
Thank you for that. Couple more questions, if I may. Could you tell me a little bit about the funds, the federal funds? Do you receive federal funds for the Connecticut National Guard?
Yes, sir. We actually, our budget from the feds that we get $300 million basically and we use the $6 million of state funding to help execute that $3 million that we get from the federal government. And that's both personnel and payroll in addition to construction, and that also includes funding our traditional soldiers who come in on the weekend and do their annual trainings throughout the summer.
So how much of the military department budget directly supports the National Guard?
So I'd argue 100%. So without those uniform members, I don't think we'd really have a demand for any state workforce per se. The majority of our state, the state payroll are our physical folks, our maintenance folks. They keep our armories clean and up to date and within all compliance to regulations, and our construction folks, environmental engineers that help us assist in the building of military construction. We get usually get federal money, and then through the state bonding, we get the match, and that those engineer and environmentalists assist in that process to ensure that all of our members have the goal is to have the most state-of-the-art type of facilities throughout the state. We have 37 different facilities throughout Connecticut, and we have members in just about every, if not all, zip code throughout the state.
Oh, thank you. And I know you kind of described you talked about the recruitment and being able to attract and get more people recruited. Is there anything else that you didn't cover when it came to that, just to make sure that we have a full understanding if there's anything else?
No, I think one of the other things we'll do, and this really falls on me, is how we can better work with other state agencies. You know, whether it's the state police, or we've recently had some collaboration with Department of Labor. So all of our website is now right on the splash page of the Department of Labor. So personally, I think I could do a better job coordinating with Department of Education and some of my peers and other agencies to help us get after this problem. We think we have, a great opportunity. It's not for everyone to serve, but we truly believe that like the rest of the nation, Connecticut, we're small but mighty, and we can lead the way.
Okay. And as you know, I am one of the co-chairs for the Veterans Committee, and now the name of the committee is Veterans and Military Affairs. So if you don't mind sending us a link to whatever stuff that you put out, or to the page that you put out, so that we can make sure that we also entertain that
and
Okay.
make sure as much people know
Absolutely.
that needs to know. And please share with your team obviously here, but your other team players that aren't here, how much we appreciate what you do
Absolutely.
as you help us do what we're doing in a safer way. So thank you very much. Thank you,
Absolutely,
Madam
sir.
Chair.
Thank you.
Thank you. Representative Nucio.
Thank you, Madam Chair. First, thank you very much for your service.
Thank you.
The next question I have is in regard to the recruitment efforts. You just mentioned 71% of youth are not eligible off the bat. And then I'm reading here and it says approximately 30% of applicants fail to attain the minimum score. Is that 30% of the 29% that are eligible, or is it?
It's probably part of that same number. So they're unable to meet the minimum score on the ASVAB test that would give them the ability to join.
Okay, so they fall into the 71%.
Exactly.
Right? Okay,
Yes,
so
ma'am.
I just wanted to look at the number. And the 129,600, that's for the trainers that you were talking about to do the program?
That could be for a myriad of things, a bunch of different things. It definitely will help pay for the teachers that are helping our ASVAB improvement course. It could be a bonus for new enlistment, so a state specific bonus in addition to the federal bonus. It could be an incentive for our current members who actually bring in leads and that lead turns to an enlistment. So we're looking at a whole scope of different ideas. I truly believe if we recruit the way we have the last 20 years, we'll probably all fail. So that money will help us look at different ways to widen the scope. And it also relies on, it goes back to Representative Nolan's question, is what we see a trend is throughout the coming years. And as we look at future conflicts, what we get from the federal government has diminished. So the reality is we've received $300,000 less in advertising dollars from the federal government. So we're also looking for opportunities to utilize this funding in the budget to promote some of those efforts as well.
So that sounds like an awful lot of things. Is this enough money?
Well, we can always use more money, but this is a great first step. It's been a campaign over the last couple of years. Fully grateful that the administration has acknowledged that we are in a little bit of a rut. Nationwide recruiting efforts are down during COVID, and throughout 20 and 21, the Connecticut Army National Guard had the #1 what they call small recruiting battalion across the nation. This year we're struggling, so we're very grateful that we're going to have some different opportunities to get after it.
I'm just concerned that that number is small that's a lot of initiative, but we need, but that's 129,000 is a small number for that. The only other question I have, and I don't see it in here, I don't know if this would fall under you, but I had a constituent specifically asking me about the burial funds and how are those handled? Do those go through you guys?
So we administer the burial funds. And like I said, we do 3,500 funerals a year. It's a very good news story in that the state funeral program is in excess of the bare minimum that you get from the federal government. So every veteran that's deceased in the state of Connecticut gets a firing squad, in addition to the flagfold, the bugler, and a 2 or 3 person presence.
And that's paid for by the state?
Yes, ma'am.
Okay, so the federal funds that we get for internment, do you guys handle that piece of it?
Oh, okay. I'm sorry.
Good afternoon, ma'am. Major Hainanen. I believe you might be referencing funds from the Department of Veterans Affairs for burial purposes.
Yes.
And General Yvonne was referring to military funeral honors,
Honors,
which are
right.
performed by members of the Guard and veteran service organizations. But the Department of Veterans Affairs administers the burial funds, internment funds, ma'am.
Okay, so that's not you guys then?
Right.
Yes, ma'am.
Okay, thank you very much. Thank you, ma'am.
Thank you. Representative?
Thank you, Madam Chair. I'd like to start off by thanking you, General Yvonne, and you, Major Heinen, for your hard work, your dedication as U.S. Army soldiers. As you know, I'm the Vice Chair of Veterans and Military Affairs on the House side with Representative Nolan. And when we met, you had spoken a little bit about improvements and constructions to the drill hall in the Armory. I haven't seen any language on that. Would you mind touching on that a little bit, sir?
Yeah, so I'm going to ask Matt Wilkinson to come up here. In a nutshell, though, we have secured bonding. So thankful to the General Assembly for approving the bonding. We've been delayed because of COVID, and there was actually a bid bust that I'll let Matt explain.
Yes, sir. My name's Matt Wilkinson. I'm the construction and facilities manager for the Army National Guard. So last year, we did send that project out to bid, and we had a bid bust, and our agency is authorized to self-administer or agency administered projects under $2 million, and the bids came in over that. So we pulled the project back. We did some redesign work and broke the design up into a few components so that we could get into our statutory agency administered accounts. That project is currently out to bid and it's posted. The bid opening is February 21st for that project. We're very confident with the design changes to it, as well as just the market's a little bit more friendly to us, that we'll be able to award that project. And then the construction will begin in this summer, probably the June, July timeframe, based on getting through the contract award process. The project includes the resurfacing and line striping painting on the drill shed floor itself, as well as some acoustical treatments, which will kind of help if you've been there before. It echoes pretty bad in that facility during ceremony, so it will reduce that. It also adds sound system, and it gives us the ability to future expand to have large video monitors in the space to help with some of the events that we take place in there, such as the inauguration, higher ed graduation, as well as our welcome home and send-offs for our own soldiers.
Thank you, sir. Just one other question about the STEM trailer. General Levon, sir, you mentioned that you're using the STEM trailer kind of as a forward-facing unit to be able to engage on some of the benefits for your recruiting efforts. I'd like to ask, does the STEM trailer or vehicles like it in your toolkit need any updates? And if not, when was the last time that the STEM trailer and similar items in your toolkit have been updated?
So the STEM trailer is probably within just over a year old, I'll say. So part of the resources that we received will hopefully continue the maintenance and upgrade to not only the trailer, but what's inside of it. The majority of our vehicles that you see around that are now almost 100% wrapped are federal vehicles. So that's a federal GSA contract. We really have a small number of state vehicles, none of which are dedicated to recruiting. They're mostly dedicated to our maintenance staff. But we have, through that GSA contract, most of our vehicles are upgraded every year. This trailer will be unique, and again, we'll use some of these additional funds that we received to keep that up to date. Hopefully that answers the question.
Yes, sir, it does, and it's an honor to be able to see you here today, and thank you for the good work that you do, sir.
Thank you, appreciate it.
Cool.
Thank you. Yep, go ahead.
Thank you, Madam Chair. Thank you, General, and the team for coming here today before us. I just had a question as far as the recruitment effort. Do you have a percentage of, you have recruitment goals? Do you have a percentage of what you're actually hitting here right at this point in time?
So we're probably at 45 to 47%. I think last year we probably were about 50%. So we have a federal mission. It's based on the categories, prior service, brand new enlistments, and then I tack on even more for our state mission as well. But last time we ran the numbers, we're about 45%. Our mission this year is the mission that I've tasked the team with is 550. And that includes different categories, not only enlisted, but also warrant officers, professionals like doctors and lawyers and things of that.
Thank you. That's pretty near and dear to my heart because I have a son-in-law in the Marines right now. He's a recruiter in Florida, and he's having a terrible time getting people on board. So
there's a Marine to Army program, Marine to Guard. We'd love to have him, and he can live here and serve here.
I'll mention that to him. The other thing, the CST team.
Yes, sir.
Is that that's near and dear to my heart also as a former emergency responder with deep I was a division director there, and it's an integral part of our response team network in the state of Connecticut. And I just want to know how that's going as far as funding for that, because there are people in the room, some of the instruments and some of the things that are carried out with this team. If there's a terror incident in the state, this is one of the assets that's going to be called. So just if
So
you can
that's
touch on that.
just a great question, sir. It's a 22 member full-time unit that we have up in Windsor Locks, brand new facility. The funding is fairly strong from the federal government. We've got new equipment. They probably have the best communications equipment within our force. They can, outside of their trailer, they can go on the high side on SIPR as well as manage NIPR email. They're recently, the team, part of the team recently deployed to support DEEP actually last week. And we're pretty proud of them. One of the initiatives on the federal side is that we have a cyber CST-like team, but they are, as far as I know, their funding is not in jeopardy. 2 years ago, there was some discussion that now that civilian agencies have maybe come up to par with the capabilities that they have, the funding may be in jeopardy. But when we look at the POM and the out years and the FIDEP, we do not see that over the next 5-year cycle at all.
Very good. Good to hear that.
Thank you.
I for one, I'd like to visit your STEM trailer at some point. Maybe I can make an
Absolutely.
appointment with one of your staff.
So we've got until I think the first Tuesday or Wednesday in June. So we'll get it across the street in front of the armory, and we'll have our operators and some young soldiers that operate that and airmen out there to kind of walk you through it, maybe during a lunch period or something in the afternoon, if that works. Absolutely.
Thank you very much, Jenna.
Okay, sir.
Thank you, Madam Chair.
Thank you. Thank you. Are there any more questions? Thank you, gentlemen.
Thank
and
you for your
lady.
time. Appreciate it. Thank you.
Thank you. Thank you
Thank
for
you.
your testimony. Okay, next we have Department of Emergency Services and Public Protection. Good afternoon, Commissioner.
Good afternoon,
Good afternoon.
everyone.
Would you like to introduce your team with you first? and
Yes,
then-
I will.
Okay.
Seated to my left is Ami Plurd. She's the CFO that's been with us for 8 months. And seated
Oh,
behind me-
welcome.
Well, you'll appreciate this. She's the woman that says no to me most than.
I like that.
Seated behind me is my executive assistant, Scott DeVico. So good afternoon, Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee. I'm James Avella, Commissioner of the Department of Emergency Services and Public Protection. I'd like to begin by saying we fully support the governor's proposed budget. And included in the proposed budget is continuing funding for 3 state police trooper trainee classes, totaling 255 new troopers. This proposed budget also includes funding for a data scientist, who I can answer questions later about. And it also includes the governor's proposed budget allocates 1.5 million federal ARPA funds to support phase 2 of the clean slate implementation. Building on the hard work of 6 different divisions within DEST, I'm confident we are positioned to make the very most of the assets provided by the governor. And thank you for your attention, and I'm prepared to answer any questions.
Thank you, sir. Thank you. And thank you for coming before us today. First question that I want to ask is, under the governor's budget, you have a personnel count of 1,557 employees. And then his recommendation brings you up a bit to 1,561. Of those, how many of them are actually filled positions and how many are we still looking for?
Well, obviously, the 4 proposed ones are not filled. We have 1,286 folks that are filled. We have 9 pending, and we have 68 vacant positions with refill authority. That leaves us 198 positions that are not filled.
198?
Yes,
Okay, all right.
including the proposed.
Okay, so right now, with the 68, you have 9 that are in transit. So have you given offers, or you're going to give offers to those 9 positions?
Well, as fast as we can, as fast as we can work with HR. We've been making offers.
Mhm. Okay, okay. Last year, you had a number of ARPA and carry forward programs that you were working on, and I don't see them all in this budget. And I'm trying to make out heads or tails on where you are with all of your ARPA funds. Is it possible that we have the printout? So I think Scott's the one who's been communicating with us. Could you give us an idea of which ones are still ongoing? Just the ones
Sure.
ongoing, not the ones that aren't, just the ones that are ongoing.
Certainly. As you know, you funded the gun tracing task force. That is up and running and working with the alcohol, tobacco, and firearms.
How much was that funding?
That was 2.5 million.
2.5? Okay,
The auto theft task force is up and running. There are still some departments that are needing to complete some of their contracts with us or MOUs. That is 2.6 million for 2 years, 2.6 and 2.6.
it was, and that one was what one?
Auto theft task force.
Auto theft, okay, all right.
The lab did get considerable money, 1.5 and 1.3, along with another allocation that I will find for you. And that is for the purchase of equipment along with a vehicle for a mobile. So what that is we've purchased quite a few NIBIN machines, which are the ballistic intake of cartridges in comparison. We've also purchased numerous rapid DNA machines, and we've placed them in and around the state. Our next deployment will put both the NIBIN and rapid in Troop E in the east. We'll put both rapid and DNA and NIBIN in Hartford. We'll do the same in Waterbury. Bridgeport and New Haven have purchased their own. And we have a kiosk that operates in Meriden for trained officers to enter 24 hours a day, 7 days a week. And the funding also includes a van, a mobile van, which also includes a rapid and a NIBIN machine. So we can start to collect evidence from around the state. Rural roads. That one is up and running. We're about to distribute upwards of 600,000 in the next month or so. There are some towns that have requested upfront money, and we're working through that.
Excuse me, is that the one with the 31 town MOU that you're working on?
The number of towns,
There was one with 31.
32 contracts. We currently have executed 32 contracts with the rural
32.
road.
Okay,
14 of those requested advance.
okay.
So we do have some leftover spots, and we are pairing through some of the smaller towns that.
Is it
want that.
feasible that you're going to get MOUs out? And I saw some that just said they're in the planning projects, projects are still being in planning and things like that. So is it possible that some of them just aren't going to get off the ground?
No, they're gonna get off the ground. 32 contracts have been executed.
Mhm.
And we're gonna push out the door about 600,000 within a month or so. So they're operating. They're
Okay.
moving.
Okay. What about the expanded violent crimes task force?
Okay, that would be next.
Okay.
The rural roads was 2.6 million.
Mhm.
The violent crime task force is being run out of special investigations for the Connecticut State Police. That is running in the eastern portion of the Connecticut. It's running in Hartford, New Haven, Bridgeport, and Waterbury.
Okay.
Online abuse, I'm sorry, violent crime is 1.1 million.
Okay.
Online abuse is $500,000. That is coming along nicely and is assigned to emergency management and homeland security. They should have something out, they thought, before the end of the fiscal year. Fire data, that's $300,000, but that runs several different years. So that is a compiling of data over several different years in the fire service. That's being run by our fire academy. Post in the high school endeavor, that is $200,000. They're moving forward and should have something out, they thought, by May. They're working with Goodwin College, which has sites in East Hartford and also in Bridgeport. And that will develop a pilot for a mapping to use later on. Potaconic Fire for 150,000. I mean, that one's moving to, that should be out the door soon. Preston Volunteer Fire for 150,000. That one is also moving and should be out the door soon. There is a post. There's 500,000 left over from post, and they're working with Eastern Connecticut State College for the racial side of training. That will be out in May on a train the trainer basis. They're also working with Manchester Community College. So as soon,
I'm sorry, it's called, what was the title of that one?
it's assigned to post.
Okay.
It was $500,000 that was carried over,
Mm-hmm.
and that is for racial equity in law enforcement.
Okay. Okay. Okay.
So the proposed budget also has 1.5 million of ARPA funds for phase 2 of Clean Slate. That scope of work has already been determined and is beginning to move with our contractor, IDEMIA. Does feel like I'm missing one or two, but
That's okay. That's a good summation, because I was
Okay.
trying to get what, if I still have some more, I'll come back and ask for you. That's all.
Perfect.
Thank you. Thank you very much. Questions, Senator Austin?
Thank you, Commissioner. Thank you for all that you have to do. So I have a couple of questions. One, on the rural roads, in talking with many of them, the Attorney General didn't like the language relative to funding the troops to go into small towns that have neither a resident trooper nor a municipal police department. They sent me some language on all, because I'd like to make sure that we're getting this out to other small towns. So I just wanted to let you know about that. And because when I did the calculations, I thought there was going to be enough money left to do those small towns also, like Voluntown and Franklin and a couple of other small towns relative to that.
all right.
and
There
so-
is some money left over. I am aware of the back and forth with the Attorney General's office. But I signed the master on January 6th. So it is beginning to, but Scott made a note of that, I'm sure.
Okay, great. So I just wanted you to know about that. And you also handle not just state police. I think a lot of people think that you just do state police, but your department also handles firefighting and the fire training schools. So we have 9 fire training schools, and essentially they're flat funded. Have you heard anything from the training schools, or do you feel that these dollars are the right amount to go to these fire training schools?
The fire service has approached me requesting more money. Unfortunately, these are just operating costs for all these fire schools, and they're just a pass through for my my agency.
So does anybody in your agency ever go out and see the conditions of the fire schools and make sure that we are paying attention to them? I know we have a brand new one in Eastern Connecticut, but there's always 1 or 2 that's coming up for renovation. So I just want to make sure that somebody's paying attention to what we have left to do to the fire training schools. Do you know where we stand on that?
Jeff Morse is very astute. He's the director of the Fire Academy, Fire Services. He really runs a tight ship.
So if Jeff could come to a subcommittee meeting, that would be really helpful, just to go over the fire training schools. And with that, if Jeff could let us know on the volunteer firefighting training, which was firefighter 1, we'd like to expand that to firefighter 2. And I want to make sure that there's enough money in there to do that. So if Jeff could say, where does he stand on funding those particular grants that go out to pay for firefighter 1, but we'd like to see if we can get people into firefighter 2, and there was one other certification that they would need. So if Jeff could come in and at a subcommittee meeting and go over that, that would be helpful.
Will do.
And relative, the governor took away the $1.5 million. That was a legislative priority, actually from a number of House members. And so we'd like to know how much money actually went out. Did any of it get spent? And if we put 1.5 million, does that adequately support that system if we put that back in?
To date, we've spent, we've handed out approximately 700,000, maybe a little more of the 1.5.
Okay, thank you, because I think that a lot of people found that to be a valuable resource, and it's not a new program. It's actually a revitalized program relative to the firefighting system and what we use them for, because many of them respond onto our highways, and there a lot of them are volunteer companies that really don't have the resources. So that was very, very helpful to them. And you had the Police Association of Connecticut as a line item. What is that reference? 172,353.
The Police Association of Connecticut, it pays claims under state statute 3-122, relief payments under the bylaws of any police officer gets sick, injured, line of duty death, submitted related claims. Also under 323, 3-123 is the same for firefighters. It's budgeted annually and account for claims. Unused funds always lapse unless there's some rare circumstance.
Okay. So those are my current questions. I may have others, but I'm imagining some of my colleagues will get to them too. Madam Chair?
Thank you, ma'am. Yes, Representative Chair.
Good evening, sir. Well, it's
Good
not quite evening yet. It's getting there. I'm still
Almost.
stuck a couple days ago, so.
Someplace.
It's all blurring together now. I have a couple of questions. Specifically, the first question I wanted to ask about is the regulation, prevention, and education of adult recreational cannabis use. In the there's two positions in here, about $1.2 million. Just for clarification purposes, I'm wondering if you, how we're going to go about that training for our officers, what the process is going to be to bring that to Connecticut, because I know that it was pretty hard to obtain before and it was only happening in Arizona. So I'm wondering what this is for and what we plan to do with it.
Okay, these two positions have already been hired from the receivables accounts. So they're now being fully funded. So what you're talking about is the DRE program and maybe the ARIDE program. The DRE program is a 3-week program, 2 weeks in state and 1 week out of state. Arizona and I believe Florida is the second. Those are held yearly. We did graduate 15 law enforcement officers this year. Last year. There's another class scheduled to go later, earlier in the fall, I'm sorry. So we have 61 DREs today and well over 400 ARIDE people. And in regards to the ARIDE training, that training is conducted at post once a month.
So will all the officers effectively have one form of training?
2. You have the ARIDE program out of post, and then you could choose to go to the second. And there's a formula by cities and towns around the state accepted by the post council.
Okay, so how many officers do we think will be able to get trained with that 1.2 million? Because I have to imagine since January, this is something that they're going to be encountering a lot. So making sure that they have that training is kind of key.
Well, that's one class every month takes up quite a bit of time and resources. So there is a possibility to extend a few more of those classes rather than once a month. So that training can be advanced for the ARIDE. The DRE is scheduled through DOT, and that's questionable on expanding that right now.
Okay. Do you happen to know what it would take to expand that to get as many officers trained as possible?
For the DRE
And
or
you can,
the
you feel free to
ARIDE?
get that for, forever. Honestly, whichever is the best program. I understand post is, I don't think it's as intensive a program as the DRE, right?
That's correct.
So the ARIDE is kind of high level, whereas the DRE is definitely more in-depth, right? Personally, I think we need the in-depth, but I'd just like to kind of understand what it would take to get as many officers as we can through these trainings. So we've got, people that can identify this problem on the road.
Well, your ARIDE is an advanced roadside detection, simply put, and your DRE is a drug recognition expert. So the second program, the DRE, is far more intense, and that one is only once a year for us right now. The ARIDE, that is given quite a bit, so that will expand exponentially every single month.
Okay, and the DRE, then how many officers are we planning, how many troopers are we planning to send through that training in the next 2 years?
It's a combination of both troopers and municipal law enforcement. I don't know over 2 years. The next class is scheduled for early fall, approximately 15.
Okay, so this is also extended to the municipalities, not just the CSP.
That's correct. There's a formula around the state for officers and troopers.
And all of that, the municipal funding is out of this 1.2 million also?
I believe so, yes.
Okay. The other question I had is a follow-up to what Senator Austin was asking. The elimination of the volunteer fire companies on limited highways. Have you consistently seen about $700,000 that we've been paying out in that, or was it only the 1 year?
It was reinstituted, so it's only the 1 year. And that's to date, 700,000.
Okay. I know you may not know this, but do you happen to know the logic for why the governor is cutting this from the budget if we're seeing it being used and it's effective?
I have not spoken directly to the governor about this, but it is a service that's provided not only for locals, it's provided for the highways also.
Okay. Then let's see. Did have one other question and I am not sure what it was. Oh, we had a conversation during lunch today about fleet vehicles. And we noticed there's a expansion in here for a vehicle for training. What happens with the fleet vehicles as they transfer out? I understand that they're leases, so after the 5-year lease, what happens to those vehicles? Do they get transferred to something else? Do you have the ability to keep one of those as a training vehicle? Is there, what's the life cycle of the trooper vehicles? I almost did Stanley.
So, there's a lot that goes with the fleet, obviously, right? The expansion in the fleet budget is because the costs are rising.
Yep.
Everybody's costs are rising as far as motor vehicles. A rough figure for you, after it has to be upfitted, it doesn't come complete. It has to have certain things put in it, and it has to have technology. So you can probably figure an average price is going to be anywhere from $73,000 to $75,000 per vehicle on that 5-year lease. Your question indicated what happens after that 5-year lease. If that vehicle is in good shape, it still maintains in service. We do like the typical lifespan of a vehicle is about 150,000 miles, which includes those that are crashed with 10 months or 100 miles on, or those that are lifespan longer, right? So those are kept. Once we have no use for that vehicle, it's sent to auction with DAS.
Okay, and the, any money that's recovered from the auction, does that go back into the budget?
It goes back into the general fund.
It does, okay. And then I had a question regarding the Acadis Learning Management System, the annual subscription. I'm not sure, was this funded with a federal grant before? And if it's so, is there the opportunity to reapply for that federal grant?
So if you're looking, is it the 62.5?
The 62.5, yes.
Okay, that Acadis program is very expensive, and,
Mhm.
and it's included in another post line a little farther down. That Acadis, the one you're talking about, was actually acquired through a fire grant. So we acquired the actual program, but we can't push off a maintenance to bonding. It has to come out of your general fund.
Okay, so that's maintenance,
for
not,
fire. yeah.
okay. And then the last question that I have is, there's funding in here for dive instructor training, and I believe this is going to be kind of using like a train the trainer. Our guys who already do this are gonna be doing it. Can you just kind of expand on the benefits of having our own people do the training rather than outside consultant? Is there like a savings in here with us doing a train the trainer program?
Yes, you explained it all right there. There is a savings in training the trainer. It's a technique used across all areas of law enforcement and fire to bring, you train the people, and you can exponentially expand your training up to.
So then that savings would be baked into this plan somewhere else, less consultant and just doing the train the trainer.
It'll be less training, sending them away.
That's all I've got for now, sir. Thank you very much.
You're
Thank you, ma'am.
You're welcome. Representative Paris.
Thank you, Madam Chair. Commissioner, how are you?
Good, sir, and yourself?
Good. Thank you for joining us today. Just want to turn our attention to the State Forensic Science Laboratory allocations that we're talking about today. There have been prior conversations with this committee and obviously throughout the legislature in terms of backlogs within the state from the Forensic Science Lab. For those who are watching at home, that obviously does hold up some of our local municipal police forces as they're trying to solve cases and make sure that they have all of the necessary findings in order to make arrests. Can you just share with us some of the improvements that have been made in that time since you've last been with us in terms of the backlog?
Well, backlogs have been decreasing across the board with the state laboratory. Let's take DNA, probably the most exploding area that we have. Now you have rapid DNA that's deployed throughout the state. So you could get a lead within 8 hours after a crime, after it's looked at by a scientist. But then it has to be sent into the state laboratory for more forensic parts. Guns, another hugely expanding forensic area for us. So we put that NIBIN, or the ballistic for these casings, into the field, where officers now get a lead within 2 days, probably, if there's any connections to other crimes. And then it comes to the lab, and it might sit at the lab because they have a lead and they're working on it, so they don't need that ballistic, right? So sexual assault kits is very little backlog. That's an important part because that's an entirely separate grant. That's a high priority for us. You may see some backlog on tool marks. That's kind of going out it's kind of waning. But overall, they're staffed. We just authorized a couple more positions for them, so they're pending for a couple.
So that does answer one of my questions around staffing, because that was obviously a concern. I just wanted to check in on that. If I might, just, Madam Chair, with one more question. Equipment, software maintenance, supplies, all very important, obviously, to the work of the Science Forensic Laboratory. And as was stated in the budget, that these requirements were previously funded and supported by federal grants. Can you just explain to us why we're no longer going after the federal grants this year?
Oh, these grants, so you're taking a chance of whether we get these grants, which are now beginning to go to other states, because, you know, we're doing so well at the state laboratory, or these grants are sunsetting and they're not going to be around anymore. So that's more the case, that they're sunsetting, but we still use that technology. You still need the updates and you still need the software.
So to be clear, you're still going to go after the grants, regardless of what the appropriation will be coming to that line item, but the timing on those grants being approved and dispersed to you from the federal government is the reasoning for your request.
Well, actually, the ones we're going after, we continue to go after grants, but what we're seeing is sunsetting grants that have this cost. That's where you see that cost for.
All right. Thank you, Commissioner. I appreciate your answers.
Representative Nolan.
Thank you, Madam Chair. I had a lot of questions, but I don't know how Rep. Nuccio got them. So I just I don't ever see her in my office. I don't know all those 5 questions, you know, so, but thank you for those questions. And thank you, sir, for coming before us. I just want to do some transparency for some people that asked in regards to our division director and data science positions. Could you just explain the driving need for those positions?
So the director position in post. So ladies and gentlemen, fully transparent here. Post was always a recruit only training facility for both state police and for municipal. They've now got into a little more deeper into certification. They're now into decertification, which is a lengthy process. And they're now into helping towns with the tier system or accreditation. And that's where that position will go to, is accreditation for towns. And those are 3 levels of accreditation. If those who choose the state tier system versus the CALIA, the national system. So that's where that position will be.
Okay.
The second one, what was that one again?
The
data scientist?
Yes. Data
All right, so that one is mine. And that's an interesting one. And I copied it from the FBI, actually. We generate data over multi-sectors of deaths, right? We have fire data, we have post data, we have laboratory data that's huge. We have data from the Connecticut State Police. We have that next gen system that has data in it. But all it does is it sits there. It needs to come out so we can make decisions. We can make informed decisions that are financially sound also with that. There's no one that puts all that data together. So that's the purpose of a data scientist.
Okay. And that was 3 positions for that, or just?
That's one position.
That's one position. Okay. Thank you for that also. And if we can go back to DRE, the training for DRE, that seems to be something that a lot of municipalities are in need of.
And I'm just curious, as far as I know, Arizona might not be doing it anymore, that it's now on the East Coast that we're doing the
Right.
DRE training down to Florida and maybe North Carolina.
That's correct.
But can you explain why you might think that Connecticut does not just create this program so that we can have this in Connecticut as being one of the blueprints that we have? Is it costly, or could you explain why we're sending people away instead of doing the training ourselves?
Right. So it's only running in a couple places. As you said, Arizona may not be as robust anymore. Florida is. It really revolves around a green lab, a practical lab of smoking for, and we have to find those people, and ingestion of marijuana and its derivatives. So that is the biggest part of it. That will come in time for us. So we'll have our own program, I imagine, in a couple of years.
Okay, is it already something that you have details of line item stuff that will be needed? Is that something that you're
No,
putting
actually,
forward, or I'm trying to, I guess, say, I hear you saying a couple of years, but what is needed from us to make sure that we can make that happen? Because I know, like, when we're doing training for DUI, it's kind of similar, where people have to intake stuff. But I just wanted to make sure that we're not throwing money in other areas, in Florida, giving money to Florida while we can do it here. So just trying to alleviate that cost of going outside of Connecticut when we have post here, and I think that we're capable of doing that. So I'm just curious why we're not.
I think we are capable of doing it. Let me get back to you on the Green Lab participation portion of it. That may be the stumbling block right now. And it's a group of us, right? It's DOT, it's the Yukon folks, traffic safety, and it's us involved there too. So let me get back to you on the Green Lab section. That is the point of where we stop.
Okay. And with the ballistic helmets, do we do RFP for those, or is that something that doesn't take RFP?
No, that they would come off a state vendor. They're 2,000 a piece. So there's going to be 40 helmets out of that $80,000. And some of the older ones will begin to trickle down, but that's off a state contractor already.
Okay. And I'm sorry, what do you do with the older ones? The older helmets?
If they're still within certified, they will trickle down to the younger ops.
Okay. And if they're not certified, there are a few legislators that will put them in their offices.
Well,
I do not want one.
I'm just saying, I'm not the only one.
I do not want one.
Okay, she doesn't.
Everybody else can get one. I do not want one.
Well, whatever happens, the investigation will go to Chief Casanova here.
Thank you for that. And could you just touch on the driver instructor training?
The DR or the A-RIDE.
The A-RIDE.
The A-RIDE, the advanced detection. We try to get as many officers in once a month, and that comes from the local municipalities. Obviously, there's a backfill for those local municipalities. So I've spoken to the director, Karen Bovier, down in Post. She thinks she can expand the program, but one a month is what she thought was adequate. But let me discuss that with her first.
Okay. Thank you for coming before us. I appreciate it. Thank you.
Anytime.
Your staff, and I hope to soon make a trip to start seeing some of our state police barracks, just to have conversation with officers there, just to hear what they say in regards to what's going on in the state of Connecticut. So
Just let us know.
Thank you, Madam Chair.
Thank you. Representative?
Thank you, Madam Chair. Thank you, Commissioner and folks for coming out today. Most of my questions got already discussed. But I do have a question as far as the barracks in this state. What's the age of some of those barracks? Because there is one in the district that I'm serving in that's quite interesting. So can you just share just the rough range of age of the buildings there? And I'm particularly interested if there's any long-term plan to refresh some of those facilities, going forward, on a when the time is right.
Right. So late in 20 and early in 21, I did my due diligence. We had some money some money we used to conduct an analysis, use a professional company out there and conduct an analysis of all of DEF's facilities, which means not only the CSP facilities, but all the other 5 divisions. There were several troops that are very, very old, 80 years. And they're the cookie cutter ones. And some of those are in tough shape, right? And those are the Danielson, Bethany, Canaan, and Hartford, right? So those are some. We recently got some more money and DAS did secure a company to begin talking to us about what we think would be a cookie cutter replacement for some troops moving forward. So that is moving too.
Okay. All right. So there's something on the horizon at some point. Thank you.
Thank you, Representative Nuccio. Exum.
There are 2 Tammys here.
Tammys, I know.
Good afternoon, Commissioner. I just have a question around stress reduction. I just don't know what that is. And if you could tell me what that means, and that would be helpful.
Okay. So in the budget, stress reduction was eliminated, right? It was reduced. But in the new contract, we are giving troopers, I believe it's $500 per year for stress reduction, or what should better be called wellness, right?
Yes.
And that means a sound trooper, financially a sound trooper, physically, psychologically, just makes for a great employee on a long-term basis. So that would be just the short version of what wellness is.
I remember this now from when we talked about the
Yeah.
contract.
Yeah.
Yes, absolutely. So I didn't realize it was the same thing, and I totally agree. I think it's money well spent, well invested. Another question I have, just because you're here today, and I don't see it reflected here. There was some conversation when we were working on the children's mental health legislation around potentially having social workers embedded to help answer calls or making sure dispatch, the right person was dispatched for the right kind of situation. Just curious, again, it's not reflected here. Is that something that is being considered or piloted or anything of the sort? Anything you comment on? I'm not sure if you're familiar.
No, I am familiar.
Okay.
Like every other police department in the state, we submitted a plan to post indicating what we thought worked best for the barracks. The barracks aren't just situated in a town and just handle that town like police departments are, right? They handle 80, 100 square miles up there and quite a few people, right? So we're different than just the regular police department. So what's been happening is a crisis kind of intervention. It's been working at, it's already working at Troop E. Troop B, it's moved to, E in Montville, Danielson, and it's now moved to Westbrook, Troop F. And there are plans to expand that to Troop L. Our best partner here is the Department of Mental Health and Addiction Services, and they've been very good with us. Some of the money that we're funding comes from our anti-heroin grant that was awarded. So really taking people away from law enforcement and diverting them, right? So we don't re-victimize them again. The war on drugs is not really a war on the user. We have to change that. It's a war on the supplier, and it's a war on the local seller.
Thank you very much for that. And I would love to just get a little bit deeper on that at some point, but I appreciate your explanation. Thank you so much.
Certainly.
Representative Delaney, then Representative Nuccio.
Thank you, Madam Chair. Afternoon, Commissioner.
Afternoon.
Thank you for being here with us today.
You're welcome.
I wanted to ask you a quick question about the 1.5 for the Clean Slate Phase 2. It says that it's for the implementation and information technology. Could you expand and break that down a little bit for us, please?
Clean Slate is, I don't want to say confusing, but it's complicated would be the much better word for it. If you've seen a docket, so a charging docket comes from law enforcement, there may be 4 or 5 or just one charge on it. And then it goes into the prosecutor's office, it enters the judicial system. And when it comes out or alters, it's usually doesn't look the same as when it went in. So they're complicated charges. We work with judicial. We also work with probation and Department of Correction to make sure that those charges have been discharged in some fashion in accordance with the law. We have a vendor, IDEMIA. We pushed out a very rapid fingerprint system well over a year ago. And when you ask about backlogs, there are no more backlogs for fingerprints. So that's our vendor. 1.5 is going to our vendor for their scope of work. The initial scope of work is 1.1, 1.2, but there is a second part of that that will eat up the rest of the 1.5.
Roger that. Thank you, sir. And it is good that it's complicated. We like complicated here. So thank you.
I could go for an easy one every once in a while.
Let me clarify that he wants complicated.
Thank you.
Yeah. We like simplicity.
I do like complicated.
He's new, he'll learn. Senator Austin and then Representative Nuccio.
Thank you very much, Madam Chair. Okay. So I'm looking at and I've looked through this a couple of times and I don't see it. And I don't know if I'm just missing it. And I know that we talked about adding an additional couple of classes. Where is that? And it's in the budget.
We didn't see it.
I don't see it, and it's kind of surprising to me. Where am I supposed to be looking for this, Commissioner?
It's the trooper classes are baked into my PS line, they're baked into the OE line. So a couple of years ago, we wanted to really break down what it costs us to not only hire a trooper, uniform a trooper, salary for the trooper, and a car for the trooper.
Right.
Not that they will get a new car. But
I know, I always hear that the new guys get the old cars and the old guys get the new cars. I hear about it all the time.
just like growing up. But so we baked it into the PS and into the OE. So it's in there. For
Okay.
3 classes for 255.
Okay, and so because you have some leaving and some coming in and you're not really at that number is baked into both of those?
Yes.
And I just, and I noticed when you were talking to Representative DiCaprio, that you talked about Danielson, Bethany, and a couple of other places that have cookie cutter, but all your troops pretty much have older facilities. Would that not be true? Troopy is not really designed for today's policing.
It was a good gas station.
It was a good
my
gas
oldest,
station, but it is not a good, it
my-
needs work.
My newest troop is probably 25, 26 years old, and it's either C or L. I don't know with Stafford or
Tolland.
it's
Tolland
a-
is pretty
yeah.
new.
or Litchfield. That's
Better
the
than,
newest troop.
better than using an old gas station that stood outside a toll station. Yeah. Is it? So, the reason why I'm asking is, because, one of the questions that I was asked about was, what happens to temporary surrenders somebody you pick up on a Friday night and they have to be held until they go to court on Monday or Tuesday, whatever the next business day is. Do all of the folks that you pick up end up in corrections, or do you hold them in the respective troop?
We try not to hold anybody overnight or through the weekend. We try to ship them off to the Department of Corrections.
Do you have an agreement to do that? The reason why I'm asking is because I was having this conversation with a couple of people relative to temporary surrenders, and they said all inmates are held at a facility, not in the Department of Corrections. They were held at a jail, or they were held at a detention facility that Hartford may have one and New Haven may have one. And so I was trying to equate this to what happens with the state police. And when I was in the Department of Corrections, we used to get temporary surrenders on at least a regular basis. Certainly wasn't large numbers, but and I just wanted to know, do you have a memorandum of agreement relative to transporting to a Department of Corrections facility?
I will check, but it's been going on since before I was here, but I'll check and get back to you.
All right, that's great. Thank you, Madam Chair.
Yes.
Thank you, Madam Chair. So as usual for today, I'm going to dig down a little bit on what the first Tammy asked about. I would like to talk about the expansion of the crisis program specifically. I believe you said it's currently in D and B. Is it in D and E?
It's currently in Montville, E,
E,
and up in D, Danielson.
Danielson.
F is Westbrook.
Yep.
And we like to expand it to L in Litchfield.
Okay, so it's in D and F. Okay. So I'm wondering what it would take to expand it to all of the troops. I'd like to understand the cost of the program and what it would take to expand it, because I talked to a lot of police officers. I'm very involved in my troop, and I know that this program in D, I know one of the state's attorneys in D, and this program has been extremely successful. I think it does a lot to help alleviate a lot of the worry of the troopers who have to go to these calls and don't necessarily know how to do it. And it definitely is better for the community as a whole. And since it has been so well received and it is really producing some really good results, I would love to know how much we need to put in here to fund that for all the troops. I didn't think it was a massively huge expense to do this, but I do think it's a very valuable service. And I'd just kind of like to understand a little bit more. Is the intent right now for the next 2 years built into this budget only to expand to L? And what do we need to do to get it out to everybody?
So the intent is just to try to get it to L, but I'll have to get you what we cost out these programs per troop. And every troop is a little bit different.
Right.
So I will forward you those numbers.
Okay, because that's something, if we can get that for the work group, I definitely want to look at what we can do to try to get this done, because I think this is a really valuable service to everybody. I think it does our communities well. I know our EC rates and everything else, like this is something I think could be really beneficial. And as Tammy had mentioned, I'm not sure what in our bill that we passed last year, what kind of funding was in there for this, but I know we specifically talked about this type of service. And we talked about it from the children's mental health perspective, but this is definitely something much wider than just children. So I didn't ask it before. I'm glad she tickled my memory on it. And I would definitely like to know what it would cost. If we were to put money in here for that, is it something that we could roll out throughout the remainder of the troops?
We'll get you those numbers.
Perfect, thank you.
Representative Paris.
Thank you, Madam Chair. Commissioner, earlier you made mention of some funding for racial equity hiring and practices. Could you just share with us some of the specifics regarding how the funding will be implemented moving forward?
Okay, so it wasn't for hiring. It was actually for training.
My apologies. Thank
No,
you
no,
for-
that's all right. It's for training police officers. We used to call it in Hartford fair and impartial policing, recognizing those racial inequities. And so that is part of it. We've worked with Manchester Community College, Eastern Connecticut State College. We think we have a train the trainer program that will be good. And that will begin to roll out also through post.
And you'll be bringing in outside trainers, I'm assuming. Is that correct?
I'm sure we will be, yes.
Okay, thank you very much. I appreciate the answer.
welcome.
Thank you, Madam Chair.
Are there any other questions? Seeing none, you're all set, Commissioner. Yes, Commissioner, you have a question for us.
How many helmets?
No helmets, not for me. I want not a helmet, not one helmet. I don't want one helmet. I don't want to have anything to do with it, not at all, under any circumstances.
God, I
No,
think she said no.
The house.
no. In case anybody had a question about it, no.
All right, have a good weekend, everyone.
Bye.
Are we still recording?
Yes.
Yeah.
Yeah, we're recording until the end.
Is this the end?
No.
Oh, gosh.
It's not. There's a second side. Nice try. Is the insurance department, Commissioner Mays here? Hi, Commissioner. I see you online.
Good afternoon, and I'm hoping I can get my system going here. So,
Okay.
and I can see Jim Carson there. Just tell me whenever we're ready.
So Commissioner, thank you very much for coming. I see you have your team with you. As small and mighty as the agency is, can you just give us an overview?
Absolutely. Let me begin here as I scroll down on my screen. I'm hoping, yes, I can see on my screen that you can see me. And Senator Austin, Representative Walker, Senator Berthel, Representative Nuccio, and distinguished members of the Appropriations Committee. I am, as was just mentioned, Andrew Mays. I'm Commissioner of the Insurance Department for the great state of Connecticut. And I do want to thank you on this lovely rainy Friday afternoon for the opportunity to provide testimony in support of the department's proposed budget request. The core mission of the Connecticut Insurance Department is consumer protection. The department carries out its mission by enforcing the state's insurance laws to ensure that policyholders and claimants are treated fairly. In addition, the department closely monitors the financial condition and practices of insurance carriers to help ensure that a healthy industry is available to provide a wide range of insurance products to Connecticut residents and to pay covered claims arising under the products provided. The governor's budget increases funding to the insurance department by supporting 15 additional positions. That would be 5 under existing funding levels and 10 with the increased funding, along with supporting the department's training, travel, marketing, reporting requirements, and equipment, all to effectively carry out the agency's mission. The operations and products of the insurance industry are becoming ever more complex as insurers are increasingly using advanced technology, such as various types of predictive modeling. Artificial intelligence, machine learning, big data, which includes external data, mostly from third-party vendors who create and manage complex data models, have all reshaped the insurance market in recent years. Currently, most insurance companies have used predictive modeling in their product pricing for the personal lines. So that would be private passenger, auto, and homeowners. And some of their commercial lines, general liability, commercial multi-peril, commercial auto, workers' comp, lines like that. And we anticipate that's not just continuing, but increasing in nearly all insurance products. The industry has used artificial intelligence and specifically machine learning, that being the next level of that, in their operations to improve the operational processes in marketing, claims, underwriting, and numerous other functions. Carriers have changed the way they approach risk and the way they engage with policyholders. In this department, must keep up with the times. For the insurance department to effectively perform its regulatory duties in this evolving and ever more complex technological environment, we too need to change. And this includes adding to our available skill sets through evolving training opportunities for current staff, so upskilling current staff, and hiring additional staff trained in, for example, data scientists, to not only better analyze the data, but also to address the tremendous increase in both the volume and the sophistication of the modeling work that technological advances have brought. Thank you, Madam Chair. I'm prepared to answer any questions you may have.
Thank you. So, Commissioner, you have 145 current staff, and the governor added in another 15 staff, and you think those are necessary to keep up with the times and to make sure that you're able to address issues with insurance broadly?
Absolutely. Just to provide some context, our staff in the not too distant past was at 180 and did get cut down significantly over the past decade, I would say. We did, among other things, bring in a consultant because I did have concerns. We look at what we have to do. I know the staff I have, they're the best regulators you're going to find, but they need to be able to look ahead, not just focus on what's immediately ahead of them, in front of them. And there were a number of recommendations that came out of the consultant that we hired. One of the most basic regulations was that we were simply too short-staffed to keep up with the work that we needed to do. And the governor's budget recognizes that, reflects that reality, and positions us to keep pace with the industry and with our fellow regulators as the best in the country.
Thank you, Commissioner, for that. And then looking at under the governor's recommendations, one of the things is to $20,000 to support the captive insurance division, networking, marketing, et cetera. We have the captive insurance that we use for the concrete, crumbling concrete
Yes.
issue that we have had. Are there any other captives in the state right now? I think is it Vermont that has the most captives?
Vermont has the most captives. You are absolutely correct. Connecticut, I do have to tell you, we're catching
Andrew.
up. We're way behind, but we're
Break his
catching
neck.
up. We have some of the best captive regulators you will
Whatever you
find.
gotta do.
The
Hold on 1 minute. I think, could somebody? Thank you. Go ahead, sir. Did we lose you? Oh, no, you're muted. I'm sorry, Commissioner, somebody muted you. Can?
Okay, let me
you
unmute
go.
myself. Can you hear me now?
Yes, we can.
The legislature has done a tremendous amount over the past few years to modernize our captive laws. And certainly over the past 3 years, we have been the state with the greatest increase in the number of captives. And we have won 3 of the most significant captive awards from the captive press. We've been named top captive regulator. So we've got, I think we're up in the 40s right now, and the numbers just keep on increasing. We have not just the skill set that we now have the laws that encourage companies to form captives here. The Crumbling Foundations captive, CIFSIC, is one example of that, but it is actually a special example of a captive. Right. Usually a captive will be formed by, and in the most cases, these are large corporations in order to address their special needs.
Thank you for that, sir. And then my last question, and I will see if my colleagues have any question, is relative to bail bondsmen that you might handle through the insurance department. We're looking at bail bondsmen broadly, in particular, those who follow up with someone who has not gone to court as required by their particular contract with that particular person. But sometimes they tend to overstep, in my opinion, only their bounds by entering homes without following the same rules that we would require of our police officers. So that is a bill that we're talking about. So How many, do you know how many, bail bondsmen and others that fit into that niche that, you are responsible for in the insurance department to oversee?
I'm not sure if my deputy Jared Koski has that information. He is there. I can tell you, I do not. Bail bondsmen are one of it's an interesting group that we oversee there, and we do have limited authority over them. If Jared does not have that information, if you do, please speak up, Jared. But if you do not, I will be happy to get that information back to you as soon as possible.
Yeah, thank you, Commissioner and Senator Austin. Yeah, I don't have the exact number, but I think as we have spoken with you before on this issue, there's two sets of bail bondsmen. There's those that are the professional bail bondsmen who put up their own liabilities with regards to the work that they're doing, and they are effectively regulated by the Department of Public Safety. And then there are the surety bail bond agents, which is the entities, those persons who we regulate at the insurance department. I don't have the number there, but we can provide that to you.
Thank you. I appreciate that. Are there any other questions? Representative Nolan, followed by Representative Nuccio.
Good afternoon, Commissioner. Thank you for coming before us along with your team. I was just trying to get a little bit of transparency in regards to your positions, your 15 new positions.
Anthony, nobody can hear you.
Can you hear me? Oh, how's that?
Yeah.
I was just getting a little clarity in regards to your 15 new positions. Could you just explain the increased workload?
Go ahead, Commissioner.
Again, let me step back to where we were not too many years ago. Our authorized strength was at 180 back then. So you can see that what has happened because of financial and other restrictions, we've significantly reduced staff. One can only do, and given the fact that the insurance industry has become ever more complex, we need that high skill staff in order to properly regulate the industry. We can only do more with less for so long. And I can tell you, we've been doing a tremendous amount trying to shift things around. We've been trying to get people out of their, I don't want to say out of their comfort zones, but upskill them so they can take on new work. But we do need, and this was borne out by the study, and happy to share the results of that, the consultants report with you. We do need extra staff. We need data scientists, for instance. We're hiring 2 data scientists here. We need insurance examiners. Part of what we have to do is to make sure that the companies, as they go along, that these companies are solvent, that they're able to pay their claims. We need examiners to be able to do that. There is also the idea that as we look at companies, they come in, they come to us, they've got products, and they have these, it's so very different from the old days. They have products that are really just this huge ball of mathematics. They're either, the easy products are the ones that are straightforward models. And we're looking at machine learning. We're looking at all that goes into these new products that are coming in front of us. These are increasingly sophisticated products that previously we would not have had to handle. Now we do. We need the skill sets in order to be able to do that. If we're going to protect consumers, because that's job one. We're going to protect consumers. We're going to make sure that they're covered, and we are going to make sure that there is a vibrant, healthy industry that consumers can trust. That's why we need the resources. It's not been a secret over the past few years to the insurance committee. Certainly, insurance and real estate has known that we've been trying our best with what we have. We have a chance now to do what we should, or what we should have been doing over the past years, and I'm grateful for this opportunity.
Thank you for that answer. And if I can go to another question, that would be about the 20,000 to support climate change. Could you just be clear, get some clarity on that? People are asking a little bit more details, and I just want to be able to explain it or hear them.
Did you say climate change?
Yes.
Yes. The legislature does require us to provide an annual report to the legislature on what we have done to support climate change. And we do have to have a consultant available to do that. I think those might reflect those charges.
So is that 20,000 for the report?
Yes. That may be part of the cost of the report. I don't have the line item in front of me. I can go back and check on that and get back to you. But I do know that last year when we did the first report, the total cost was somewhere over 50,000. So it may be that we've managed to reduce the total cost of that report.
Okay, if you can get back to us on that.
Will do, Representative.
And then you also have $10,000 to support third-party costs associated with creating the biennial climate change progress report. Now how is that different than the 20,000?
It may be, let me step back a little bit because I can get that. I just don't, I'm looking for it, don't have it in front of me. It may be, we also have the Connecticut Conference on Climate Change and Insurance, C4I, which has become a signature event for the Connecticut Insurance Department over the past, we've had 2 so far. This will be the 3rd coming up this year. And what that does is it brings together experts from all over the country, all over the world, to discuss climate change, insurance, how the insurance industry, what role the insurance industry has to play, how consumers are affected. So I may have the numbers flipped there. One may be for the report, the other for the conference and the associated costs with that. Okay. But again, Representative, I just don't have that in front of me, so I will take a look and I will get back to you shortly on that.
Okay, I appreciate that. And I was going to ask you about the other expenses line item, but if I'm not mistaken, I'm going to assume the other items are the $100,000 to support increased staff at NIAC, 66,000 to support additional travel costs, 50,000 for financial regulation, etc. And then the captive insurance division, and then the climate change and the
to more accurately reflect the training costs that are associated with the various staff functions that we have.
Okay, thank you, sir. And thank you for your staff for being before us today.
Thank you, Representative. And again, I will be back to you shortly with the information you requested.
Have a nice day.
Thank you, Madam Chair. Thank you. Representative Nuccio.
Thank you, Madam Chair. Good afternoon, Commissioner Mays. I'd like to say I do quite interact with your staff quite a bit. So I am pretty familiar with what you guys do over there, and thank you for that. I do have a question though regarding the 15 positions. I understand the keeping pace with industry and the complex benefit creation that we're seeing now in the world of fully insured products. What I was wondering if you could give us some more color on is the 2 higher level positions you have in here: an assistant director of health policy and a chief of staff.
Right.
Go ahead.
Yes. Going back to the idea that we've been incredibly lean. What we have right now, and I'm sure I think you know Paul Lombardo, who's the head of our Life and Health. He's the Assistant Deputy Commissioner for Life and Health. He's also an actuary, and he has been doing, I would say, if I were nice, I'd say double duty. I'd say it should be triple duty. What we're looking at as we move forward, certainly as the governor and this administration and the legislature attempts to reduce cost growth of healthcare, there are increased requirements, and we need the staff to be able to address that. We don't have the bandwidth right now. I mean, that I think we're down 2. We need to bring back at least 1 person in that division, and that's where we're looking for an assistant director of health policy who will be able to manage that as we go forward. So that will address the increased role in health initiatives, and it's going to, as we look at the complexity of the health laws, we look at the assistance that we have to provide other agencies, and of course the Office of the Governor and the legislature. That's what that function will be doing. And the other one was the chief of staff. And part of the concern, certainly part of my concern as I look to leave this agency in better prepared for the next decade than it was when I came in, is that there is no function that is focused simply on managing staff. as opposed to being able to manage staff, implement changes, do pretty much everything that has to be done. Jared Koski, who's my deputy right now, I'm not quite sure how he does it, but he's got to cover everything. Yeah, that was one of, again, going back to that Deloitte report, that was one of the recommendations of that report. There is simply too much of a demand being placed on that position. We previously did have, and this is before my time, there was the equivalent of a chief of staff available. That has not been there during my time, and I think we need it in order to better manage the agency.
Could you share that Deloitte report with us by chance?
I'm sure we could. Let me just reach out and we will have Jim send that over to you shortly.
I appreciate that. And you're right, Paul is a gem. I spent a lot of time on the phone with him yesterday. Him and Jim have been extremely helpful on the insurance committee. The only other question that I have is, I know there's a lot of legislation floating around right now about putting an affordability factor into the rate review process, which directly falls under your area. And I know you and I have talked specifically kind of about the role of the Department of Insurance and how you would manage something like the affordability idea. I'm assuming that this budget does not account for the possibility of any type of affordability legislation passing.
This budget does not address this. What this budget does is it gives us, by adding the Assistant Director of Health Policy, there is the ability to interact better with the other agencies. So there's going to be that added bandwidth. But in terms of looking at affordability, no. We will, as we go forward and the cost growth benchmark is provided by OHS, we are going to be looking at that, and we are going to make sure the carriers who come before us for rate increases are justifying their rate increases, the part of the rate increase that deals with trend, the increasing cost on, vis-a-vis what's going on with the cost growth benchmark, so that the cost growth benchmark, it will in essence serve almost, we hope, as a cap on the increases. But short answer, that's not in this budget now.
Okay, that's all I have, Commissioner. Thank you very much.
Thank you.
Any other questions? Seeing none. Commissioner, I just think that you have one of your staff here too. Yes?
Yes.
Jim Carson, Legislative Liaison and Communications Director. I just wanted to let you know that we've been all waving at him during your whole time. So thank you very much, Commissioner. Have a nice day.
Thank you, Representative. Appreciate it.
Yep. Up next is the Workers' Compensation Commission, Stephen Morelli, Chairperson. Mr. Morelli, the floor is yours.
Good afternoon, Chairwoman Austin. My name is Stephen Morelli. I'm the Chairman of the Workers' Compensation Commission, and here to discuss our budget for our biennial budget for fiscal years, the 2 fiscal years upcoming. On this call with me are my agency legal director, Marie Gallahall, and my fiscal administrative manager, Frank Calvi, who will be much more capable of explaining the details of the budget to you than I can. I will briefly just say that the Workers' Compensation Commission's budget is generally considered a fairly simple budget. We're not part of the general fund. We're a special fund. And like our budget, our mission is also fairly simple, and that is to help injured workers with the goal of getting them prompt medical treatment and prompt payment of lost wages, while always treating employers fairly in equal measure. So I can tell you that in the last calendar year, the Workers' Compensation Commission did over 49,000 hearings, and that's a number that's been fairly consistent, including in 2020, the pandemic year. We did over 48,000 hearings. Didn't really skip a beat during the pandemic, and we're very, very, very proud of that. And that's a testament to the hard work of the judges and all the staff of the Workers' Compensation Commission. With that, for the details of the budget, I'll turn it over to Frank Calvi. Frank, if you want to just skim, just run through the items, that'd be helpful.
You're muted, sir. There you go.
Hello, Senator. I just wanted to reiterate with Chairman Morelli just mentioned, we're a special funded budget, as you're aware. It's very, simple budget. We only have 4 budget categories, personal services, fringe benefits, other expenses, and a small percentage of indirect overhead costs. I mean, basically, we receive our quarterly allotments, to run our agency, to cover salaries and fringe and other expenses. The governor actually proposed his proposals for 24 and 25 were increased slightly compared to what my recommended budget was. And that's pretty much it. We just basically a simple budget, to keep our agency functioning. And that's really all I could have to say.
Thank you for that. Mr. Morelli, can you let me know, where does Connecticut stand on workers' compensation costs? Are we ahead, high, or low, or where do we stand? Do you know?
What I can tell you is that the assessment that is used to essentially, for want of a better word, tax the employers of the state who fund our budget has gone down for several straight years. So I think Connecticut is quite affordable compared to our neighboring states. I can get back to you. I can certainly provide you with more information that I can get from some of the national associations as to where we stand on a national level, but off the top of my head, I don't know that, but I'd be happy to provide you that information as soon as I can.
Great. I believe that's because we passed a law that dealt with a hospital structure, to have a hospital fee structure that's actually made a big difference in the cost of workers' compensation. That was a bill that I put in a number of years ago, back in 2014 or 13. And I think
Senator, you're absolutely right. It is a function of the medical fee schedules and the facility fee schedules that has made the assessment stay continue down and the costs go down over the years.
So if you could get me that, I'm curious about that. So
certainly can.
Thank you very much. And it could just come over in an email to us. Does anybody have any questions? Representative Nuccio.
Thank you very much, Madam Chair. The first question I have is really just, there's $1 in equipment. Is that just, obviously it's not $1, right?
I have a hard time hearing her.
Can't hear you.
Sorry, that in the budget, there's $1 in the equipment line. I'm assuming that's just not, that shouldn't be there.
Yeah, it's just what happens.
Go ahead, Frank.
Oh, okay, I'm sorry. What happens is that's just like it's for the Office of Management and Budget. They have always just have that $1 pretty much in all state agency budgets, even though we don't spend any money in equipment. So that's I really have no control over that.
Okay, and then the only other question I have, and this is just for my own edification, it looks like the fringe benefit line is actually higher than the personnel services line. Is that?
Yeah, that is correct. We have a fringe benefit rate of 103%. Yeah, and that's usually because of the judges that cause the fringe benefit amount to increase above the salary amount.
So Representative Nuccio is asking if that's usual, but yes, because they're counting in the unfunded liability. So the unfunded liability is they tag that on to all of those employees. That's what that's relative to.
Is that just because it's got its own fund for?
Yes.
Okay, that's why I was like, that doesn't look right. Okay, all right, that's all that I have. Thank you.
Any other questions? Seeing none. Thank you very much, Mr. Morelli, you and your staff. Have a nice weekend. And if you could just send over that information, I'd appreciate it.
We certainly will. Thank you, Senator Austin, and you have a wonderful weekend also.
Thanks. Up
And
next-
thanks to the whole committee for your time and patience. Appreciate it.
Thank you. Up next is Department of Banking. Commissioner Perez. Commissioner Perez here, yep. Is Commissioner online trying to come in, James? Thank you. Banking.
Page 10.
We're 9 minutes or 8 minutes really. Mr. Chambers, huh? Yeah. Mr. Chambers,
Yeah, I'm contacting the commissioner right now to see if he can join a little early.
thank you so much. Appreciate it. Is he coming in online?
Yeah, be
Thank you very much.
looks like the commissioner is able to join now.
Thank you, Joseph. Hi, Commissioner. How are you?
Good. Good afternoon, everybody.
We're a little early, we know. Thank you for.
Oh, no
joining.
problem. I was just waiting for 3 o'clock because I was told it probably won't be until 3:15.
Thank you very much. We really appreciate it. So we appreciate you being here. The floor is yours, sir.
All right. Co-chairs Austin, Walker, Senator, and I'm sorry if I mispronounced the name, Bertel, Representative Nucio, and honorable members of the Appropriations Committee. My name is George Perez. I am the Commissioner of the Department of Banking. And it's my pleasure to be here to discuss our budget and to answer any questions you may have. A little summary, we have 116 employees in the department, and we're asking for approximately 28 million, well, not approximately, I'm told by staff that is $28,321,024. That represents an increase of 5 staff that we will provide, that OPM is recommending based on our requests to expand our strategy around CRA and fair credit lending and to start the process of regulating cryptocurrency down the road and do more work in cybersecurity.
Thank you very much, Commissioner. I really don't have any questions. You've already talked about your position count and what you're looking for. That's one of the things that we look at. Appreciate the work you do. Let's see if we have any questions. I have Representative Nolan.
Good afternoon, Commissioner.
Good afternoon, Representative.
I know we can see it, but I just want some clarity for those that are watching. Could you explain your creation of the Financial Protection Innovation Team?
Yes.
Why and what is the team to be used for?
Yes, maybe the word team is the wrong word to use, and I know we used it. So it's an initiative, as you all know, because of COVID situation we went through and how we find out that has impacted many communities, and because of the if not reality, the perception that some communities are not being serviced by the financial institutions the same way other communities are. And changes that have been done to the CRA law that are going to affect later this year, we have determined that we need to focus more on some of the fair credit lending laws and the CRA laws. In the past, we relied a lot on the FDIC, and our goal is for us to do our own individual or joint, since we are now accredited nationally, joint with the FDIC, and also to make sure that consumers get protected. Part of that is that cryptocurrency is, whether we like it or not, regardless of what people's opinion is, it is a new financial tool out there that a lot of consumers, especially in the last 2-3 months, have been hurt big time financially because FTX and other samples of failures and or other issues that have happened in that industry. No particular entity in the state is responsible for regulating that. We do have proposed legislation suggesting that we should be the one, since it has to do with banks and financial world. And we will be proposing regulations, which ultimately will come back to all of you for approval. And we will set up different groups that we'll get input from, including consumers, including legislators, including industry experts, other regulators, and including potential, for lack of a better word, vendors, or financial institution that will be using the tool. So it's a way for us to be able to increase and to respond to the ever-changing environment of the financial world. Cybersecurity is another one. God forbid that someday we all get paid, right? And we all go to the ATM and there's no cash there, or the ATM is not working. You want to talk about a real crisis? Not that I'm saying that will happen, and not that I want to be, an alarmist. Hopefully that answers your question. If not, I could try to give you more details.
No, thank you. I appreciate that. And if I can ask a question in regards to your funding in the governor's budget of the 2,520,000. Hold on, I'm sorry. The increased wage costs that you have in FY24 and FY25. Can you explain that increased wage cost?
Twofold. One is the additional 5 positions. 2, we're in the process of filling every single vacancy we have. So we're not going to have room for uninspired salaries because every single one of our vacant positions is in some sort of stage of being filled, with about half of them pretty much being at the finish line. So we're not going to have the opportunity that if our budget was $26 million, but we know we have, say, 5 openings, and that translates to $700,000, that we have the leeway because we're in the process of filling every vacant position. Plus, there's an additional 5 people. In addition to that, it also takes into account, I'll imagine, I didn't have this discussion with OPM, so I'm now guessing that it also includes any salary increases due to negotiated, salary increases with our bargaining units.
Okay, thank you very much. And
Yep.
I can ask our chair after my other questions, but I appreciate you being here with us this evening.
My pleasure.
And we appreciate your services.
Thank you. My pleasure.
Are there any other questions? Seeing none. Commissioner, you're all set. Thank you.
Thank you. Thank you for the opportunity to talk to you guys for a little while about what our
Have a
budget
nice
is.
day.
Thank you. Bye-bye.
Bye.
Madam Secretary?